Jennifer, can you hear me?
Yep, I can hear you.
Oh, okay. Feel free to jump in at any point in time.
Does that include heckling?
Yes, please. Did you get any jokes ready?
Always. You know I'm more of a situational humor kind of person.
And you have the sound effects?
The fake applause, the rim, the punch.
Yep.
As you can see, we're going to have a very fun session coming up here. We are very fortunate to have VOLPE with us. Did I say it right this time?
Close.
Yes,
that was good.
Give it to me one more time so I can do
it. VOLPE.
VOLPE. Okay, VOLPE. I'm gonna get it by the end of the session. Each year, we offer substance abuse training workshops for Missouri transit providers through VOLPE. Got it that time, I think. We are lucky enough to have them through their virtual platform this year. The workshop will last approximately 3 minutes, but I think Michael is going to be merciful with all of you and give you a break sometime in the middle, or at least I'm trying to plug that one in for you as well.
Yes.
So if you have any questions, remember to put them in the chat. There's also a Q&A function at the bottom, so please use that as well. And I'm going to toss it over to you, Michael, to take it away and introduce yourself and your colleague.
Okay.
There.
All right. Well, hi, I'm Mike Reddington. I'm with USDOT VOLPE Center in Cambridge, Massachusetts. And I have worked with FTA in their drug and alcohol program since about 1996. So I've been an auditor, newsletter article, write newsletter articles and such. Just basically anything that has to do with the day-to-day operation of the FTA Drug and Alcohol program. And most of the day-to-day functions do come out of the VOLPE Center in Cambridge, Massachusetts. We do handle all the website work, and we are the people who represent the audit team as far as the federal government goes. So I'm here, and I also have a colleague of mine with me, Jennifer Gissel. Jennifer, can you say hi, or you shut off?
Sorry, I put the mute function on. Hi, my name's Jennifer Gissel. I'm a colleague of Mike's. I haven't been working with the program quite as long. In '96, I was, learning long division. I'm just kidding. So I'm here. I'm kind of here to see how what Mike is doing. I'm newer to the program, so I'm really interested to see how this first virtual training goes for us. And thank you guys for the opportunity to do this and to sort of shift into a virtual platform. So we are very excited, and I will let Mike take it away.
Yeah, and as Jennifer said, this is the first time we've done this, so please be patient with me. We do quite a bit of training. Last year, I think I did 8 to 10 trainings around the country, besides doing maybe 10 or 11 audits and FTA's national conference and some other conferences and things. However, this is the first time we've actually done a virtual training. And to be quite honest, we're kind of seeing how it goes. And obviously, there's going to be certain issues, and as far as the timing of how many slides in the presentation, what we cover and everything, it's a little different than doing a full day training, which is what we typically do when we come on site. I believe that you're allowed to ask questions along the way. I will do my best to stop and answer them if should there be any confusion, or does anyone have need any clarification or anything, or just general questions. That's fine. I'll
try to help you monitor that too, Mike.
Okay. And to be quite honest, I've got the chat open now, so I'm assuming the questions come through that, but I'm not 100% clear about that. So we'll see how it goes, since I'm not really an expert with Zoom here. Federal government uses Teams, which is slightly different, and I'm not saying it's better by any means. But why don't we get started? And just wanted to move on here. So there's my contact info. And you can send me an email. You can call me should there be any questions. One thing FTA does, probably more than any of the other DOT modes, is they'd be available for questions. And at the end of the presentation, I'll give you a whole list of contact information for various individuals that can assist you no matter what you have a question about, as long as it's related to drug and alcohol.
We do
we're-
have our limits on expertise.
Yeah, we're not getting into financial planning or anything like that, or relationship kind of thing. But if you do have questions with specifically FTA drug and alcohol, or DOT drug and alcohol regulations, did I do the right thing? What is a best practice? What does FTA want us to do? What does FTA not care if we do? How do we get training? Any kind of issue, feel free to give us a call, send an email.
Hey, Mike, are you sharing your screen again?
I hope so. Am I?
I don't see it up on my end.
Okay. So how do I share it again then?
Is that just me?
Mike, try on the bottom. There's the share screen. Mine is lit up green, but I don't think I'm sharing my screen. So if you, I don't know if you
Lit up
click
green. Okay.
that. Or Alt S on your
Oh,
keyboard.
Alt S is what I used before.
Okay, let me see.
Did that do anything?
It did not.
Okay.
At least not for me.
All right. I can see the screen. I do have the Zoom webinar chat open, and maybe if I close that, it says leave meeting. I don't think I want to do that.
Probably not.
Is there a window that maybe has an option to select what you want to share?
Yes, it does. So Mike, if you click the share screen, then all of my things kind of pop up.
What
All
is share screen?
If you hover over on the bottom of the video, it's bright green. It says share screen. And when I click that, I'm able to see all of the things I have open. Like I see my Outlook and my other stuff I have open. I don't know if it gives you that option.
I don't see any option. I just click on, let's see. Let me try this again.
And if it doesn't work, Mike, if you want to send me your presentation, I can try to share it and just move it along for you.
I mean, I have it up on me and I have half of now Zoom. So I may be out of, am I out of Zoom then at this point in time?
No, we can see you on Zoom. If you maybe scroll over, if you have a Zoom icon on the bottom of your screen, it might be open in a separate Zoom window. Sometimes Zoom will open 2 or 3 windows.
Yes, I have that too. I have 2 open. Let me see.
I have quit Zoom, start Zoom, close window, and I have the presentation. I have a start Zoom, if you want me to do that.
I don't know.
Mike, is that the same presentation you emailed me yesterday? Or did you make any tweaks to it?
I believe it's the same.
Okay, let me pull that up just in case. Let's see. Okay. And as we said to other participants, thank you for your patience. This is actually my first time on Zoom. As Mike said, we use MS Teams. So
it's just different enough to make everything a little bit more complicated.
Exactly.
Yeah.
Okay, so I have Mike's presentation open. So let me try to share my screen. Okay, and if you guys can tell me if that worked.
Yes. Mm-hmm. You might
Okay.
want to start slideshow.
Yep.
Perfect.
All right, Mike, are you able to see it?
I can see it. It's very small. It's tiny.
Interesting. You don't know it well enough to just do it without visual aids?
Well, I have the presentation. I have the presentation up. I can do it. Yeah. So I'm just going to go ahead and do it on my presentation.
Okay.
Okay.
So yes, just as I said, or as Mike said earlier, excuse me, here's his contact information. We'll have a slide at the end with the hotline contact information and other people. If you don't, if you're sick of Mike at the end of this presentation, you want to talk to someone else, we have other people you can talk to too.
Yes, please do. And so on the next slide is the regulatory updates and frequently asked questions. That's just kind of what we're going to talk about a little bit today. So I'm going to go on to the next slide then.
Yep.
And so one of the big issues that's been going on is what do we do with testing? How does, with COVID-19? There has been some modes such as FMCSA that has waived things like the minimum random testing requirements. Well, FTA hasn't. And so what they basically stated is that the effective national, state, or local emergency doesn't exempt FTA regulated employers from Part 655 and 40. So in other words, you still are required to do the testing, and if you don't do the testing, to at least follow the regulations as far as to document the reason why you haven't done the testing. So that relates to training and testing. You must comply with all FTA requirements. If you're not able to do it, as I stated, make sure you have really sufficient clear documentation as to why you couldn't do it, which is how it's always been. And below that is the question and answer frequently asked questions link from FTA concerning the drug and alcohol during this COVID time period. I'm going to move on to the next one for specifically about pre-employment in COVID-19. So nothing has changed. You still must receive a negative pre-employment test result prior to that employee performing a safety sensitive function. So in other words, if you're unable to do testing, you can hire someone, but you cannot put them in a safety sensitive function without that verified negative drug test. Okay? So drug test is what's required. Alcohol test is your option, but you need to have a verified negative pre-employment drug test prior to a new hire or someone coming back from 90-day leave before they can perform a safety sensitive function. And so underneath, employee returning to work, and whether this be on leave, a COVID furlough, whatever reason, if they're out of the random pool for 90 days and they haven't performed a safety sensitive function for 90 days, then you must test them, again, pre-employment drug test, and receive a verified negative test result prior to that employee performing a safety sensitive function. All right. And again, any questions along the way, we'll do our best to answer them. And then for random testing, FTA has not waived the 50 and 10% requirement, 50% for drug and 10% for alcohol. So even though there may have been time periods where you were unable to do a test due to unavailability of a collection site, let's say an employee felt that it was dangerous or felt uneasy going for a random test, at year's end, FTA has stated you still must reach that 50% and 10% requirement. And as they said, they did make one kind of leeway here in that they allowed you to make up tests at the end of the year. So in other words, if you're unable to spread reasonably across the year, you can make them up at the end of the year. And again, if you're unable to do random testing, if you're unable to meet the 50% drug and 10% alcohol, you need to document thoroughly and provide a reason as to why you could not do that. Okay. Now with return to duty for COVID-19, same thing. If someone is returning to duty, if someone has previously had a drug positive or alcohol violation, they may not return to duty unless they have a verified negative return to duty test. So even though they may have performed all the other things they need to do as far as SAP evaluation, that type of thing, they cannot return unless they've actually had a verified negative. So in this case, it's not, we can document and still go forward with this employee. They cannot return. So must have a verified negative return to duty test prior to coming back following a drug positive or alcohol violation. And then the same thing with follow-up. After the return to duty test, if the person did take one and receive a verified negative, they must complete and continue on with the follow-up testing plan. So in other words, they must follow the SAPS follow-up testing plan. If they are furloughed or for some other reason they do cease performing a safety-sensitive function, then the follow-up testing plan stops during that absence, but then it continues on when they come back. So in other words, if they're on a 12-month follow-up testing plan and they are subject to follow-up tests for 3 months, go off for 3 months, they need another 9 months when they come back of follow-up testing. So that's the same way it's always been, whether it was for COVID furloughs or for any reason, whether someone was going out for Family Medical Leave Act or workman's comp or medical or whatever reason. So that has not really changed, but person cannot resume, must continue doing the follow-up testing plan when they come back. Now, refusals with COVID-19. FTA, this was all in the FTA frequently asked questions on the FTA website. If the employee has concerns with testing. So in other words, it's the employer's responsibility to evaluate the circumstances of the employee's refusal to test and determine whether or not the employee's action should be considered a refusal. So in other words, if you have a collection site that is doing collections, but the employee refuses to go for, let's say, their random test, it is up to the employer to make the determination if that's a refusal or not. So there's no one size fits all. There's no, if they don't go, it's a refusal, that type of thing. It's really up to the employer to make that determination. And if they do determine that it's a refusal, then they'll be subject to the same ramifications they would be if there was a positive drug test result or alcohol violation. One thing that ODAPSI, which is the Office of Drug and Alcohol Policy and Compliance, which is USDOT within the Office of the Secretary, they came out because they control, this is a Part 40 issue, and Part 40 it covers all DOT. So as far as SAPs go, they're allowing SAPs to conduct remote face-to-face evaluations and assessments. So previously, SAPs were required to do face-to-face, in person. It was not allowed to do a remote face-to-face evaluation assessment. Due to COVID-19, they've allowed them to do face-to-face with some of these conditions below. Suggest document evaluation format. So in other words, you want to say how we're going to conduct this. You want to say what technology is used. Permit real-time two-way audio and visual. In other words, you must be able to see each other, to talk to each other, to speak to each other. The SAP determines if the technology is sufficient to gather necessary visual and audible information. So in other words, just as when there's face-to-face, they make a judgment of the employees by looking at them. They must be able to have sufficient technology that they can do that here also. And you can only use technology if the state issued license authorizes that. So different states authorize different types of technology. So only if the technology is state issued. So you can do remote, but there are some conditions to it. So those are the main issues as far as COVID-19 and FTA, drug and alcohol. One thing I also want to say is that during this time period, FTA has ceased doing their drug and alcohol audits. So there hasn't been an audit done since, I believe, the first week in March. Currently, FTA is debating whether to begin virtual audits. And we'll be having a meeting on that very shortly. And there has been no date set for doing on-site audits. Most likely won't be until 2021, but we'll see what's happening there. Again, there's been no final decision on that, but that's been another effect of the COVID-19 is the fact that FDA has ceased audits. We have been doing reviews of MIS and things like that, but at the very least, virtual will be starting back up. I would say probably somewhere in the November, December timeframe. So just to let you know. Another issue, and these are basically, we're starting off with kind of updates as far as things that have been going on in the last 6 months with DOT and FTA for the drug and alcohol. And one of the things that happened, and that just happened last week, is that there is now a new custody and control form. The custody control form is the form that is used to document and record drug testing. So basically what happened was the OMB, the Office of Management and Budget, the old form was running out. We're coming up on the fiscal year end. Typically, forms are only authorized for a certain time period. This was the time period for the previous form was coming to an end. And so rather than just authorize it for continued use, because there are some issues coming up down the road, which we're going to get into, DOT issued, well, not DOT, HHS actually issued a new custody and control form, authorized for use. The old form still exists, and you can still continue to use it in your collection sites, can continue to use it until 8/31/2021. So basically for about a year, okay? The new form must be used starting 9/1/2021, but the old form can still be used. So most collection sites will have kind of a back orders of forms, and they can continue to use them. And so here's some of the main changes that were in the new custody and control form, or CCF as we call it. And one of the major changes, probably the most major changes, was a revision to accommodate oral fluid specimens. And you can see it's yellowed out down there. I did that myself. So it's yellowed and this is step 1 of the form. So this is the very top portion of the form. And so there it is, oral fluid. That did not exist before. As you all know, DOT only authorized urine testing since the inception of this program. But now they're authorizing oral fluid. Now we're going to get into that because it's not quite as it seems, okay? Also, step 1, as you can see down there, changes, copies 1 through 5. Step 1, add CDL state and number to donor identification. And then it says FMCSA only. So for FTA, for all you folks, you would still only fill in either the social security number or the employee ID. Despite that fact that it says CDL state and number, that is only to be used by FMCSA for now. And the reason that is because of the FMCSA clearinghouse, which we'll talk about that in a couple of minutes. So this has potential for some issues. With people entering in CDL state and number for an FTA test. As you all know, not all FTA safety sensitive employees would have a CDL, since not all operate buses, unlike FMCSA. So for FTA, you have cab drivers can be safety sensitive employees, minibus drivers, maintenance workers, security, none of them have a CDL. So you want to be aware of that, and you want to make sure your collection site is aware of that, because you don't want them asking someone you send for a test, I need to have your CDL number, when they don't have one, okay? And then step 1 added other to the collector contact information, and that's basically for an email address, okay? So we're going to move on to the next slide now. So here's just a little bit of a time frame with the new custody control form. You may use it beginning September 1st, 2020. So you could have been using it for a good 10 days already. But beginning September 1st, 2021, you must use it. So that means your collection sites must use it. They should all be aware of that. They typically get their CCFs from the labs. The collection site is where the collection is done. The lab is where the specimen is processed. So the lab certainly will be ensuring that everyone gets a supply of the new CCFs, but sometimes you also have to request them. So you have a whole year to do that. Now, I said there were some issues with the new form, and here's what ODAPSI OST recommends. Delay using this until June 1st, 2021. That is their recommendation. And the reason is confusion regarding oral fluid testing. As I said, there's issues with oral fluid. In other words, oral fluid has been approved by Health and Human Services, but it has not been adopted by DOT yet. It will at some point in time, but not yet. So if a collector were to check that box or to do an oral fluid test, that would not be considered a DOT test, okay? And checking that box could be confusing. So what ODAPSI suggested or recommended is do not use until June 1st, 2021. Allow existing supplies to be depleted, okay? And step one, see, we talked about the CDL state and number, not completed for FTA test, remember that. So I know you all check your CCFs when you get them in. So when you do that, when you take a look at them, you should not see a CDL state and number on there. Okay, those are for FMCSA only. It was put on there specifically for the FMCSA clearinghouse. And those who don't know what the FMCSA clearinghouse is, a new system that went into effect January 6th of this year. And what it does is it's a requirement that all violations for FMCSA are stored in a national database so that potential employees can go in there and check to make sure that employees who've violated FMCSA drug and alcohol regulations will have gone through a second chance program, a SAP program, a training and evaluation and such. So there's been some changes on the CCF. Right now, they don't really apply to FTA, but what they can do is cause a lot of confusion for collectors. And one of the reasons they cause confusion for collectors is because collectors do mostly FMCSA testing, because there are about 850,000 FMCSA employers in the country. There are about 3,500 FTA. So FMCSA is larger than all the other modes combined. So most collectors do primarily FMCSA testing. So what they do automatically is check the FMCSA box, and they will go through in the FMCSA process unless they're completely aware that it's another mode. Now, when you send a driver in, a lot of times the collector may say, who do you work for? And the driver, of course, will say, I have no idea. Like, under what mode are you authorized? And the driver won't know. And then the collector will say, well, do you have a CDL? Yes, I do. Okay, FMCSA, when actually they're a transit bus driver. That happens all the time. The most common error in this entire program is that the collector checks the FMCSA box rather than the FTA box. And on audits, we're constantly seeing this and telling people that, for one thing, go back and change it. You can change that yourself, just a little cross out initial date. But we also suggest send them back to the collection site and make them change them, because they should be aware of who is authorizing the test when the person walks into the collection site. Okay, so this is another thing that, though in the long run may be good, temporarily and for now may actually cause some confusion. So I would follow ODAPSI's recommendations, and I don't always say that, and I would delay the use until June 1st, 2021, okay? And if you have supplies of forms that even go beyond that, you're not required to use it until September 1st, 2021. So use up all the forms you have. Don't pay for new forms if you don't need to. But by June 1st, 2021, some of the issues as far as oral fluids and such may be resolved, and it will be less of an issue. And we'll go over the oral fluids in just maybe even the next slide. Let's see. It is. So oral fluids. So this is something new also. And this kind of, it's been kicking around for a while. DOT and HHS have been looking for alternate forms of, other than urine specimen as far as drug testing. Hair testing was on the front burner for a long time. but it didn't really scientifically prove to be they didn't have the confidence levels in hair testing. Oral fluids did pass all the confidence levels for Health and Human Services. So they recently submitted a rule to allow oral fluids as a permissible methodology for federal employees drug testing. So that's for federal employees. However, DOT, in their regulations, DOT will always follow HHS in whatever methodology they state is allowable. So OTOT is the Omnibus Transportation and Employees Testing Act. I believe it came out sometime in 1986. That's my guess. I'm going to go with that. So they came out with that. And in that, they say, if HHS says this is permissible testing, then DOT will follow along with it. So DOT is now required to follow along with oral fluid testing. And they're not necessarily against that. However, DOT, ODAPSI, Office of the Secretary, had some questions. They didn't just fall in line with it, but they issued some questions and asked for a delay in actually allowing oral fluids. DOT tests are always split specimen tests, and the regulations are written to say that a DOT test will always be a split specimen. Well, they have to kind of come up with a process whereby you can do a split specimen with an oral fluid test. An oral fluid test being basically a swab, swabbing your inside of your mouth, your gums, that type of thing. So there were several issues as far as to the process of testing, not the reliability of it so much. So because that's the fact, and DOT was awaiting some answers from HHS, they haven't written regulations. They haven't devised a new process, a required process. As you know, DOT has a very strict process that must go step 1, step 2, step 3, very, very standard process, the same process for everyone who goes in there. Well, they haven't written those down yet. They're not part of their regulation yet. So not only do they have to document that process, they have to get it into the regulation. So that hasn't happened yet, but they're expecting that to happen by June 1st, 2021. So therefore, oral fluid drug testing is not authorized in DOT's current drug testing program. It's still only urine testing, okay? And the reason that HHS, DOT wanted an alternate method of testing was they just thought it would be a money saver, but they also thought it would increase flexibility. So in other words, you don't have the same privacy issues with oral fluids that you do with urine specimen collections. So as far as urine specimen collection, you basically need a site. You need a bathroom. Oral fluids can be done on site at post accidents, on site at reasonable suspicion areas, things like that. So oral fluid will give a much better flexibility than urine collection. And it's expected that down the road, oral fluid will be the kind of the new standard for testing, though they don't have any plans to do away with urine collection testing. The oral fluid testing also used for, that is specified here, is not the same oral fluid testing that can be used for screening alcohol tests. That oral fluid testing is, again, a swab, but what you do is you stick it into a little plastic tube, and depending on the color, it tells you if there's the presence of alcohol. It does not give you any levels. That's why you need to do a confirmation test following that, in which you blow into an EBT, and it can actually say, are you above 0.04? Are you below 0.04? The oral fluid testing for screening device for alcohol just tells you, is there alcohol? Okay. Also, oral fluid testing for drugs will be lab-based. In other words, you will package it, it will be packaged up and sent to a lab, just like the urine specimens that are now sent to the labs. So the labs don't lose out, basically what it comes down to. But also it's assumed that there'll be more testing done when it's oral fluid because it will be less expensive. You won't have to be pulling people off duty so much. You can actually do them on site. whereas someone goes out now and does an oral, pulls a person off a vehicle in order to send them for a random. If they're trained correctly, they could go out there and do the test on site right there. So it's assumed that it will save a lot of manpower hours. But as I stated, it is not authorized for DOT right now. And if an oral fluid testing is done, it would not be considered a valid DOT test. So as it says, DOT must develop its own testing process. And I know one of the issues, like I said, was the split specimen. They don't plan on going away from a requirement to have a split specimen. That is considered to be a protection of the employee. So from what I've heard, they're talking about when someone swabs inside your mouth, they're going to have 2 swabs rather than 1, because the initial HHS came back and said, okay, we can do split specimen, just do a swab, package that up and do another swab. And DOT came back and said, oh no, we don't do 2 separate collections. Urine has always been 1 collection, which it's split into 2 bottles. We want the same thing with the swab. We want 1 collection. We don't want to do it at 2 different time periods, because that increases the chance that there could be a difference between the 2. So DOT has is kind of sticking to its guns and saying, we still want to continue our process, which is kind of tried and true, in which it balances very much between employee rights and in the drug testing portion of it, the deterrence portion of it. So right now, there's a real balance, and DOT wants to maintain that balance. They thought by doing, let's say, 2 separate swabs, you're somehow kind of going away protection of employee rights, okay? So there's one, split specimen, test only for use for not exposure. There has been some concerns that a swab test will test for exposure. In other words, someone sitting next to someone which I was just in Colorado last week, and believe me, you can walk down the street and you could probably test positive for marijuana. So this was a concern for DOT too, that they want to ensure that it's not someone who just sat next to someone or who was at a party with someone, and in a lot of places it's not legal. And then and their gums got soaked, and they did a swab and therefore came out positive. They want to make sure that it's only for use. And right now, when it's a urine test, that's only someone who's used it, not someone who's been exposed to it. Okay, so that's one of the issues with oral fluids, and that's something that's coming up, and you're going to see coming up more so in the next, in 2021. And as I said, it looks like DOT is looking at June 1st, 2021 for some new regulations. And though that does seem a little quick, knowing how things work as far as having to write the regulation, have them go through legal, having to get things voted and approved on and all that. But they have been working on this for a little while, so it's very possible. So now we're going to go on to one of our favorite subjects, continue on kind of with THC and marijuana. We always get a bunch of questions asking, since marijuana is now legal, and I'm not sure how many states, I used to keep track of it, but I don't anymore. You know, how is it that marijuana is still tested for or a violation of DOT regulations? And DOT came out with a statement that state and tribal initiatives have no bearing on the US DOT's regulated drug testing program. Okay, so just because a state says we're legalizing it, such as Colorado where I was, does not mean that DOT is allowing that. So it has no bearing on DOT regulations. So marijuana remains a Schedule I drug. DOT regulations never authorize marijuana use, and the MRO will never verify a test as negative based on a physician-recommended medical marijuana, and the use of marijuana is unacceptable in all cases. So it's prohibited at all times, whether you're off duty, you're on vacation in Jamaica, and they sell it on the corner or whatever. That's the way it's always been. We've always had people who came back from vacation and said, but I didn't smoke when I was in the United States. It doesn't matter. It's still prohibited if you're a safety-sensitive employee. And even if you have a prescription for it, it doesn't matter. It's still prohibited for DOT. Okay. And also just, well, we're gonna go over this in a second as far as the marijuana use and such across the country. One thing that did come out, and I just got an email on it yesterday, this is kind of breaking news. We should probably have like the teletype thing going right now. But one thing that did happen yesterday, and I'm not sure if I'm even supposed to say this, but we did get some notice of some potential legislation for decriminalizing marijuana. That's coming out. I believe Jerry Nadler is about to file a bill any day now, stating that trying to, probably some election year politics going on here, but decriminalizing marijuana. Now, how that affects this is what the discussions are going on. In fact, there's a discussion tomorrow going on between Office of the Secretary, ODAPSI, some of the modes, and many of the legal people involved at DOT concerning that issue. So that is actually coming up. This is like current news right now as far as decriminalizing marijuana. So it is there is a potential bill being put out there for I know it's being considered right now, and there's a lot of talk about what the impact would be with DOT at this point in time, should that bill pass. So I know ODAPSI has looked at the potential of this for a lot of years, so I'm sure they're going to have a response ready. But just to let you know that that is something you'll see in the news probably within the next couple of weeks.
But
Okay.
that being said, it won't impact any of this.
No, not currently. Now, would it down the line? That's difficult to say. I would not think so. Even if it was decriminalized, and I'm not an attorney, I'm not sure what that means as far as does decriminalized mean legal. I'm not really sure.
I don't believe so.
I don't believe so either.
I watch Law and Order a lot.
Yes.
I'm
Yes.
proud to be an attorney. No, but I don't believe the decriminalization would be the same thing as legalizing.
No. And I believe DOT would, and I don't think they'd have much of a issue as far as getting support for this, would maintain that marijuana needs to be, or THC needs to be, continue to be tested for, and needs to be prohibited as a substance that someone can use who's going to perform a safety sensitive function. But I'm just saying that this still could be news. This could still result in some additional rules and regulations and things and questions. And when these things happen, they get legal challenges and things like that down the road. So I think it's something that you'll see. Whether it has any impact, I don't believe it would. But what do I know? So one of the other upcoming issues besides oral fluids is electronic records. Proposal. So DOT, it will be revising Part 40 at some point in time to permit the use of electronic forms, signatures, and record keeping. And one of the things they're going to, right now, I'm not sure if any of you are aware, but there is such a thing called an electronic custody and control form, which is basically you don't use the paper version of the custody control form. There's software that's been approved by DOT that is basically distributed by the labs. Each lab has individual software and can be used at collection sites. And so it's not the 5-part carbonless form where each of the forms goes to a different party. It would actually be, it's actually electronic. I've seen this, it's the electronic custody and control form's been around for a couple of years. However, it has never really taken off, but it is used somewhat sparingly across the country. And what it does is it allows you to, it allows the collector to just to log in and fill in the form on using some software. And what it does, and the benefits of it is that it walks you through the steps. So it's almost impossible to do the steps out of order. And if you miss something, it'll come back and say, don't you want to do this? So it'll prompt you, it'll give you warning messages, it will kind of shock you if you don't do it correctly, kind of thing. So that's what's going to be happening with the electronic, and it's only been for the custody control form up till now, but the alcohol testing form, which is a simpler form, will also be allowed electronic use in the near future. But there's also issues as far as electronic signatures and things like that, which kind of go hand in hand. Right now with the ECCF, I believe you needed some type of special signature pad to use with it. And I think they're looking at alternatives to that. So this is, again, something that's going to be coming down the road. I don't believe we're gonna see the alcohol testing form within a year or so, but possible. It may be a farther along that I'm aware of. But that is something else coming on down the road, and it's a decision for probably your collection sites to make. Although most likely, what happens is the laboratories require the collection site to do it, and that's why it moves down to the collection site. So I'm assuming that'll happen down the road also, and that electronic for both the alcohol form and the custody control form will increase over the next couple of years. It also allows storage of data much easily because you can store the electronic file rather than keeping boxes and boxes and boxes of paper files. So it's coming down the road. So here's the clearinghouse, which I mentioned earlier. FMCSA is Federal Motor Carrier Safety Administration. And again, January 6, 2020, I got the date right, good. So what this does is it allows MROs report verified drug, it requires that MROs report verified drug test results to FMCSA clearinghouse, okay? And the collector must put in the CDL number and state of issuance. So so these are two things that the MRO will do this only for FMCSA, and the collector will do this only for FMCSA. So they're two things that are particular only to FMCSA, but because there's occasionally confusion with FMCSA and FTA, that can impact FTA testing also. So you don't want your employee going in, the collector checking off the FMCSA box, maybe getting the CDL number because you sent an operator for a test, and then putting that operator into the FMCSA database, because then there's a whole process to remove them from there. It's just, it could impact future employment for them. There's a lot of issues with this. So you want to ensure that your collector, as you always do already, are only for your employees checking the FTA box and putting in the Social Security number, employee ID number, not the CDL number, okay? Because that is something that, since this is the first year, we don't really have any statistics on this yet. I know FMCSA is saying that, has said that this has been very successful, that they've identified quite a few employees who've tried to basically job shop or job jump. They get tested positive in one place, they go to another place without ever going through the SAP program. And they've caught hundreds supposedly of people, but we're also going to see how many people were misreported and things down the line. So it'll be interesting to see the statistics of that. One question we always get is, will FTA be going to the clearinghouse or any of the other modes? And the answer is probably eventually. But all the other modes are basically going to sit back and let the FMCSA kind of go through the legal challenges and all the headaches for the first few years, and then they may jump in year 4 or 5 along the way. What the clearinghouse does allow is for FMCSA covered employers to, after 3 years, to do away with the 40.25 requirement, which is the previous employer requirement, where you ask them, have you had a violation or tested positive with the previous DOT covered employer? So that'll be going away for them. So that's one of the benefits of it. And like I said, down the line, I would assume that FTA will probably be, once it's all cleaned up and everything is perfect, we'll probably be saying, hey, we want in too. So just remember, FTA covered employees are not required to participate in the clearinghouse, and ensure your collector uses the Social Security number or employee ID number in step 1, section C. The FTA box is checked in step 1, section D. So make sure it's not the FMCSA box, because whereas before it was just kind of a nuisance, now it actually could have some real time-consuming issues that you don't want to have to go through. So as we always suggest anyways, if any of you have ever had an audit or gone through another FTA training, we always say, make sure that they check the box correctly. It may seem small, and it was basically small. Doesn't require any kind of affidavit or anything to change it. It's just you can go in there and change it and date it and initial it. But now there are some real ramifications to checking the wrong box. So try not to do that, and try to make sure that your collectors don't do that, and try to make sure that you review the CCFs when they come back. All right, this is a topic that always comes up. Usually every training we have someone who raises their hands and says, I'm on CBD, can I test positive? And the answer is no. But there's some other things to it. So I'm going to go over the CBD issue that DOT did come out, and they issued a notice in February 18th of 2020. And basically it said that any hemp product under 0.3 THC was not a controlled substance, but any product greater or equal to 0.3 THC is a controlled substance. Okay. DOT does not test for CBD. So in their five panel test, it does not look for CBD, okay? So it will not test positive if you use CBD, okay? So that's great. However, DOT does test for THC, as we all know. And THC is a Schedule I drug. So if the THC, if using CBD results in a THC positive, then it is a DOT positive. And the reason that might happen is because they're related substances from the same plant, and THC could very well be in the CBD product. Now, even if you go to the gas station and get one of those little bottles that say no THC, it might have THC in it. You might not want to, you might not want to trust Ronco Enterprises from, Wuhan, China, that they
might not even have anything in it as well. It might not have any CBD.
Oh, it may not have, it might be sugar water for all you know. But I'm just saying that we have had reports where people said, oh no, I'm on CBD, and the bottle says no THC, but they tested positive for THC. And you know what happens then? That's a DOT positive test. And if the ramifications of their employer, the policy states that you will be terminated, then you know what? They're terminated.
So if you're using CBD, be very aware of the supplier.
Yes.
Or where you're getting it.
Right. You probably want to get it from a legitimate medical source. But even then, we've heard some stories. So CBD is not regulated right now.
Exactly.
So therefore, be careful, okay? Because DOT is not going to say, yeah, you're probably right. You probably really weren't using it. They're going to say, we don't care. We don't care how the THC got in your system. Same thing if you go to your brother-in-law's and he's having the tonight because, the football's starting, he's having a party tonight, and someone happens to bring THC-laced brownies and you have a couple and you test positive the next morning, that's too bad. And you might say, I didn't even realize I was eating them. I mean, after 7 or 8 of them, I figured. But in all honesty, if you come back and say, oh, they're my brother-in-law's brownies, DOT's going to say, we don't care. You have THC in your system. That's all that matters. We require that you be aware of what you put in your body. Okay? So just to let you know, be careful with CBD, because we have seen issues. We have seen it around the country. We have seen people say, I did not intentionally use THC. Whether they're telling the truth or not, I don't know, but that has happened.
Right.
All right. So another thing that has just happened is we're just in the midst of closing our database for the 2019 MIS test results. Even though it's due March 15th, I know this is unusual to hear, but some people actually submit their results late. So by the time we get through them and validate them and call them and say, no, you have 2 employees, I don't think you did 2,000 tests. we do run all the data through a validation. It's done through a validation when you first enter the data. We also run it through a number of queries to check data that's unreasonable, and we do actually call and send emails and things like that. So the 2019 test results just came out. And actually, they're not quite finalized. I would say that they're about 99.63% final at this point in time. I believe we're waiting on a couple of employers who have not yet submitted, but have promised that they will any day now. And they've said that every day for the last 3 weeks. So these are up-to-date data that has not yet been published. It will be published soon, but that's the random testing positive rate. So that's the drug random testing positive rate. Okay, so positive rate always refers to drugs. When we say violation rate, it refers to alcohol. Violation rate, instead of positive, is because alcohol has more of a range to it, and also alcohol is legal. So use of alcohol or a rate under a certain percent, under a certain amount, is not considered a violation. So and we have the little 1% over there on the left-hand side, you see in red. And what we're saying here is this is the positive rate. So this is for random testing. And the way we figure this out is we take all the random positive test results, verified random, and we add them to all the random refusals, and we divide them by the number of random tests. Okay, and that gives us the positive rate. So the positive rate also includes refusals. So the reason we have the 1 there is the 1 is the kind of the key item. So, and the reason for that is the FTA regulations state that if the positive rate nationwide is above 1% for 2 consecutive years, FTA will raise the rate up to 50%. Excuse me. And that happened in 2019. As you know, in 2018, it was a 25% rate. In 2019, it was a 50% rate. And the reason is because in 2017, 2018, it was above 1%. So FTA did what they said they were going to do. They said, we're going to take a look at it. If the data looks good to us, we are going to raise the rate. So as you can see, back in 2015, it was only 0.9, but now it's 1.16. So that's gone up a pretty good amount in just 4 years. The regulation actually, the default rate is 50% in the regulation. It went down somewhere around 2002 to 25%, and it took all the way up until 2019 for it to go back up to 50%. So it's always been somewhere around 0.8, 0.85, and in the last 4 or 5 years, it's been a steady climb, and we'll see why in just a couple of slides. But the regulations also state that if the rate drops below 1%, that FTA administrator has the option of lowering the required minimum testing rate from 50% to 25%. It doesn't look like that's going to happen anytime soon. Okay. So now this is the positive rate for all drug tests. So this includes pre-employment, random, post-accident, reasonable suspicion, return to duty, and follow-up. And I can't believe I remembered all 6 of them. But
It just rolls off the tongue.
It does. It does. I've been at this job too long. But as you can see, again, it's been going up. So last year, 2.4% of all tests were positive or refused. That is the highest number in the history of this program. Now, it went down this year, and that typically happens statistically when you take a larger sample. So in other words, we went from 25% for random to 50%. So typically when you take a larger sample, the number will go down a little. I think because it's a larger number, but also because I think it does have some impact. So, and we saw that slightly went down for random testing, where it went from 1.17 to 1.16, but which is what it should have. It should have a deterrent effect. So when there's more testing, people know that they're more likely to go for a random test. Hopefully, they are less likely to use drugs. But we'll see in the long run, because this is again, 2019 was the first year where it was 50%, where it was 50% for random. But just in general, since these are all test types, you can see it went from 1.84 to 2.4 last year. That's a very large increase. So again, we're at the levels here where we're at. This is the highest levels for the program in the history of the program right now. These 3 years of 2.16, 2.4, and 2.11, we've never been that high.
Had it not gone over 2% before?
I don't believe so. And if it did, it was very early in the program and we had far fewer employers. In fact, there was even then, it may have been in the first year, but I wouldn't have a lot of confidence in that data in the first year or two. Because it was just so new, but certainly since 2000, it has not been this high.
Okay.
Okay. So now here's the THC verified positive. And these are just straight out the number of tests that had verified positive for THC, all test types. Okay.
Wow.
And you can see it was 2,645 in 2015 and 3,900, increase of 48% in 4 years. So what do you think is driving that positive rates going up? I'd say THC is pretty, it's a pretty good guess. So you can see again, 3,900 is far and away the highest. In fact, 3,300 was the highest, and before that, 3,200 was the highest.
Right.
So we're on a real upswing. Next year, we're keeping our fingers crossed that we can hit 4,000. We'll see about that. Because it's a COVID year, we're not expecting the data to be real consistent. However, there may be more employers because FTA has been giving a lot of money, CARES money, to even those that did not previously receive FTA money. So we'll see what happens. But right now, it is going up substantially year to year.
Yeah.
And another one here. And then this is the second reason, opioid positives. So it was pretty consistent around 100 for 15 years. Somewhere around there, somewhere between 75, 120 every single year. However, in 2018, as you're all aware, FTA added semi-synthetic opioids to the testing panel. So when it wasn't just opiates anymore, and it was now opioids, which included OxyContin, hydrocodone, hydromorphone, and oxycodone, I believe is the other one. So that began in 2018 as far as the testing panel. Okay, so we can see what the result is. And so these are people not just who are using it, but who are using it illegally. So you can have a valid prescription for OxyContin and it would not be considered a verified positive. But these are people who did not use it legally, whether they didn't have a prescription or whether they were using it not in accordance with their prescription, or using their spouse's prescription, who's what actually we see that quite a bit. So as you can see, this has also had an impact. It's gone up by a good 400% or 500%. And the consistency of it is pretty remarkable. And I think that's something we're going to see down the road quite a bit. So again, 384 and 380. And this always brings up a question. I don't know if you're having any question about this, about people always ask, well, what about someone who uses OxyContin but does have a prescription? And what will happen is that the person will provide a specimen. It'll go to the lab. The lab will test it for semi-synthetic opioids, such as OxyContin. It'll come back to the MRO as a lab positive, basically stating that, yes, they tested positive for a semi-synthetic opioid. It is now then, at that point in time, the MRO will get it, and what they'll do is they'll call the employee and say, hey, you tested positive for this. Do you have a prescription for it? And the employee will say, of course I do. And then they will go around and then they will have some method whereby the MRO can confirm the fact that they have a a legal prescription, and they will look at the dosage of the amount that was detected to see if that's in accordance with the prescription. So the MRO will do some research and do some work also as far as determining, is it are they using it properly? At this point in time, if the MRO is satisfied with this, what they will do is they will issue it as a negative test result to the employer. So the DER, the DAPM will get the result that says negative. Now the employer may know that something's up because it may have taken 3 or 4 days for the MRO to do the research, to contact the employee, to get the paperwork for the prescription, that type of thing. However, they will get a verified negative. However, the MRO at this point can say, it's negative, but I really don't feel good with this person using this drug. So they're going to issue a safety concern to the employer and just saying, yes, they are negative. However, I have a safety concern because they're using this substance. It's now up to the employer at that point in time to do what they wish to do. So we always suggest that they have some type of policy that if in the case of an issued safety concern, what are you going to do? In some cases, they can go back to the primary care physician or the prescribing physician, and they can lower the dosage, or they can change the time of the dosage, or they can use another substance. But there are some cases where the prescribing physician will not change the prescription. And at that point in time, it becomes an issue for the employer. Okay, do we continue to use an employee in safety sensitive position when there's been a safety concern issued by the MRO? And so we get a lot of questions of like, well, what is FTA's guidance on this? And basically, it's you establish a policy so that you have some guidelines to go with when this a situation does occur. Now, this has occurred quite a few times, even before semi-synthetic opioids, because the MRO has always had the ability to issue safety concerns, and they did so quite a few times with amphetamines where someone had a legal prescription. However, it's something that's happened much more frequently now, so it's become an issue. But it's an issue that the employer should deal with. Okay?
All right. And eating a poppy seed bagel also doesn't count, right?
Well, I'm going to go over that in a little while, but
Okay.
If anyone ever saw the Seinfeld episode where Elaine tests positive because she's going I believe she's going on an international travel, and they tested her at her employer, and she tested positive for opioids, and she said that was because she was eating 2 to 3 poppy seed bagels every day. That cannot happen. You'd basically have to have a bucket of poppy seeds, and you'd have to like just pour them down your throat for that to happen. So, but we're going to get to that in a little bit. So I hope I'm not the only one that remembers the Elaine episode with the poppy seeds. This is one that's always people like, and because we kind of try to get people compare one region to another, and kind of get them at each other's throats, kind of thing, and say I'm better than you. So these are the random drug positive rates for all the FTA regions for 2019. So again, this is number of random tests plus number of refusals divided by the number of random positives plus the number of refusals divided by the number of random tests. Now, Missouri is in region 7, I believe. So you're up near the top. That's not a good thing on this chart. So as you can see, region 8, which is, I believe, Montana and Wyoming and kind of those places that don't have a lot of people, is the number 1. New England is region 1. New York City, New Jersey is region 2. DC, Virginia, Maryland is region 3. I think Pennsylvania is also in there. Region 4 is Florida, Georgia, Mississippi, North Carolina, Alabama. Region 5 is like Indiana, Illinois, Ohio, Minnesota, Wisconsin. Region 6 is Texas, Oklahoma, I believe New Mexico. Region 7 is Missouri and Iowa. and there's a couple other states in there. And then Region 8 is, I believe, Montana, Wyoming, North Dakota, South Dakota. Region 9 is California, and Nevada, and I believe Guam is also in there with them, and Hawaii. And then Region 10 is state of Washington, state of Oregon, Alaska, that area. I think Idaho may also be in there. And who stands out in all this? And since you can't talk to me, I won't wait for an answer. But if you can look at Region 2, 0.52, 8 of the 10 states are above 1%. And remember, we said 1% was kind of the key number. So 8 of the 10 are above 1%. But Region 2 is 0.52. So why is that? And why are they? I mean, is it just because it's New York and New Jersey and we figured they probably lied? And the reason is because New York City is far and away the largest transit system in the country. They make up about, I don't know, close to 20% of all transit in the country, as far as the number of safety-sensitive employees. They far and away have the finest drug and alcohol program in the country. There's no one else even close to them. No one else is even on the same. If you were to put them at the top, you would have to then go 2 or 3 levels down to have the next program. So given that fact, and given the fact that a bus driver's job or a subway driver's job in New York City is a very well-paying job with incredible benefits, they have a very low testing rate. They have their own collection sites, their own MROs, on duty 24 hours a day. So they have 5 or 6 collection sites across Manhattan alone. They have state-of-the-art medical that when you walked in, you would think this is, wow, what a nice hospital this is. They have doctors on staff all the time, and they do a lot of testing, just not drug and alcohol. So they're doing eyesight testing and hearing testing and a lot of other things. They have they have an incredible medical program. So that all leads to them having a very low positive rate. Mm-hmm. But they also have, between them and their contractors, probably in the neighborhood of 45,000 employees. So you saw that we had the first year of over 1% in 2017 for random positive rate. It would have been 2016, except for New York City pulls it down. You take out New York City, the country is way above 1%. It's not just at 1.16, we're talking 1.3, 1.4. So New York City pulls the rest of the country down as far as the positive rate. And again, you would have been at 50% at least 1 year, maybe even 2 years early if New York City was, let's say, just had a mid-level positive rate. But they are the ones that bring it down, and they are traditionally always, Region 2 is traditionally the lowest positive rate for random drug in the country. In Region 8, which is the smallest region as far as the number of employees, is typically first or second in the state. And again, they have, again, a much smaller population base in those states. And surprisingly, Region 10, which people always think, well, Washington, Oregon, that's going to be high, they're traditionally fairly low also. So I will move on to the next chart. Oh, okay, that is the last chart for that. But I just continuing on the MIS is, I figured I'd put it in here since we're looking at the MIS charts, is that you should expect an MIS notification letter within probably in about 3 months, okay? So typically we send it out in late December. Is that 3 months? October, November? Yes, it is. Yeah. So 3 months. So we'll send it out in late December. And it will go to the certifying official that you put on the MIS the previous year. Okay, so we understand that the certifying official sometimes knows nothing about the program. It's not the DAPM, it's not it's someone who's sitting in a corner office, but that's who it will go to. If you did put in the DAPM in addition to that, because on the MIS we do ask you if you would volunteer to give us the DAPM. This year we will probably also send a letter to them in order to ensure that we do get timely response. So that'll go out in late December. And the reason we do it in late December is we used to do it in early December because we figured we want to beat the Christmas rush. So we want to do it. And also we didn't want to sit around the table on December 23rd because this is how we do it. I sit at the table and a couple other people sit at the table and we all make excuses and try to leave, but we end up like stuffing the envelopes and then bring them down to the mailroom. So
You
we
look
do.
forward to that every Christmas season?
What's that?
You don't look forward to that every Christmas season?
I do. It's kind of like one of those things that every year you say, oh, I'm gonna it's gonna be great because my Uncle Louis dresses up as Santa. Plus, I get to do the MIS mailing every Christmas. It's kind of the two things that I think about.
And sometimes you dress up as Santa for the.
Who's that? Me?
Yeah.
Yeah. Oh yeah. Yeah. No. That I they asked me not to do that anymore. So we send that out in December. And the reason we do it in late December is because we used to do it in early December and we get it out there. And then what happens is we start getting the phone calls saying, I want to be able to submit my data, but the system's not online yet. Or someone would send the paper form to us. And of course, why are you sending us the paper form or trying to submit online when it's a calendar year report and the year is not over yet? So don't try to call up and say, I want to submit my data on December 15th when there's still 15 days to the year, or 16 actually, because it's a calendar year report. And we would say to the people, well, why are you trying to submit? The year's not over. And they said, yeah, but it's the holidays. We're probably not going to do any testing. And it'd be like, okay, well, accidents happen. Hopefully you are doing your random selection spread across the year. So we then had to alter our mailing of the notification letters because people were sending them too early. So now we try to do it so that they arrive on site somewhere around December 29th, 30th, 31st, so that they will still be able to submit starting January 1st in our online system, which you can see down in the blue below, damus.dot.gov, will go online January 1st, 2021. And we will check to see if anyone actually submits on New Year's Day. And I don't know if I'm a bigger loser or the person who submits on January 1st, 2021, me for checking and them for submitting. But usually someone does actually submit on January 1st, 2021. So on January 1st of that year. So we will send that out. The system will go online and you have from January 1st to March 15th to send the submission in and be on time. Okay, once you're March 15th, you're on the bad list. So the letter that we send will go to the certifying official. It'll include the username and password and the website, which you see down below. The username and password changes every year. Don't try to use last year's. It's a government requirement that we change it every year, so it's not our option. We would love to keep it the same every year. It will not go to your contractors and subrecipients, even if they provide all your service. It goes to the FTA grantee. Okay, so once you get it, it'll say to you, okay, log in with your username and password, and it will come to the status screen, and we're going to list all your subrecipients and contractors there. Tell us that we have them all, or tell us if we have extras. And then you have to either email us or call us and say, okay, Acme Transit is no longer have a contract. Goodyear Tire no longer does our tire changing. We've added First Transit. So we need that. We need that to keep up to date so we know that we have all the testing information from that year. So you need to inform us who those are. Because contracts change so much, all honesty, we will probably have several hundred contractors change in a year, a good 700 or 800. So there's quite a few changes to do. So you will either call us with the number that we provide, or you will send us an email with the number with the email we provide, and that's what we'll do. And so yeah, so and then not only do you need to inform us, but you also ensure that the contractors and subrecipients actually submit their data. So when you log in, you will look at the screen and you'll say, hey, there's a username and password for my contractor. I'm either going to ask them for the report and fill it out myself, or I'm going to give them the username and password and fill it out. Either way, once they complete it, they're going to hit submit, and you're going to get a little email that says, your contract is submitted. Now it's up to you to approve it or reject it. It doesn't get submitted to FTA until you approve it. Once you approve it, you've stated, I believe this is true and correct, okay? So you need to ensure that the data is complete and accurate. And one of the things we do on audits is we do check the MIS data against when we go on site and actually look at the records, okay? And just remember that each covered employer, grantee, contractor, subrecipient submits a separate MIS with FTA results, okay? So if this is employer-based, so if you're in a consortium, and you're one of 7 employers in the consortium, don't send in a consortium report. Each of those 7 have to submit an individual report. If you are a city or a county and you don't actually provide the transit, you don't provide the service, you actually contract with First Transit, MV, Transdev, one of them or someone else, and they provide it, you still must submit a report, even if it's zeroed out because you have no safety sensitive employees. However, the money went through you, so therefore, and you are the grantee, so therefore we want you to submit something, okay? So remember, it's a employer-based report. So each employer must submit. So there's no combining, oh, we're all in the same pool, so I just sent in one report. No. If you were in a pool with your contractor, that's still 2 reports. Okay? Oops. And there's the phone number and the website that I talked about. So, and the email address.
What number slide are you on? I just want to make sure I'm
on 27.
Okay, there you go.
I may have, like, again, you and I are using something different. These are probably going to appear later on in your presentation that I sent you.
Oh, okay.
I think I did a last minute change here.
Got it. I'm like, I don't see a phone number.
Yeah. So anyways, but it's later on. MIS reporting questions, FTA Drug and Alcohol hotline. This will be in later on also. And it's 617-494-6336. Call. I will pick up. Jennifer will pick up. Laurie will pick up, or Felicity will pick up. Those are basic. That's basically your federal staff for your day-to-day operations of FTA Drug and Alcohol. So one of us will pick up. We also have an email address here, fta.damus@dot.gov. That's all in the letter that you will get also. Please call. We figure somewhere around 2,500 calls a year or emails. So yep. It's okay to be one more. And even if you have questions outside of the MIS, just call. If you have questions about post-accident or random selections or oral fluids or policies or I want training, call this number and someone will pick up. And there's a link there for online guidance. Basically, it's the FTA website and you'll see a button on the side that says MIS. Click there and there's some guidance on how to fill your MIS form. So I'm at the regulations now. And I'm trying to figure out what time it is because I'm an hour ahead of you people.
Right.
What's that?
Mallory, you had mentioned a break. Did you?
Yeah, I think this would be a good time for a break actually, because this changes from updates to regulations. So I know I could use a break. How about if we have a 10-minute break at this point in time? Come back at 3:17.
Sounds like a great idea. Thanks, everybody.
All right, thank you.
All right.
How do I get back to Zoom? Join meeting. See, I think it kicked me out at some point in time.
Okay.
But join meeting doesn't do anything.
I just know when I have it open, there's a share screen option, and that's how I got it.
I don't have any share screen option.
They just didn't. They knew you'd have something crazy, and they didn't let that happen. All right. I like the we could hear Macy in the background.
Oh, could you?
Yeah, I could hear her shaking. I
Oh,
assume
yeah.
it was the little dog tag.
Sure, she's looking for someone. No one's paying her attention.
Exactly. Someone pay attention. I am like amazed. My cat hasn't screamed for attention.
No, well, you know, I've given up on that. So,
Yeah.
okay, so this is supposed to go to what time?
That's a good question. Let me open up.
I mean, it's 1:45 to 4:45, which would be 5:45, which will be. So I am right about the halfway mark.
Yeah. No, you're making good time.
Okay, that's what she said. We're getting to Michael Scott now. Now I'm getting into Michael.
There you go. From Elaine to Michael Scott.
Hey, the Elaine story is good.
I know. I had to. Once I was like, oh gosh, the coffee secret.
Oh yeah.
Got to do it. If you want to email me a more updated presentation so I make sure I have it, feel free.
Okay. I'm not in my VOLPE.
Oh, I
Remote, though.
forgot.
I can
Okay.
go into Gmail though and send it to you.
If you want.
Yeah.
Okay. I'm going
So
to.
you're just the standard jennifer.kissel@dot.gov, right?
Correct.
Okay. Sometimes you see someone has something different, and you're like, what?
Yeah.
How'd that happen?
That's what happens when your name is John Smith. That's 47.
Actually, you pop up. Oh.
Oh. Oh, that's interesting. And then we can take that.
I think I just sent it to you.
Okay. It'll probably take a second.
I think I should get out of Zoom and go back. But everyone can hear me, so I'm still in.
Yeah, everyone can hear you. I just want to get into the screen sharing. It's fine.
Okay.
It keeps me awake. I have to change the times, otherwise it is snoring at my end.
So have there been any questions?
Actually, let me check. I went to no. Someone's but
That's great.
yeah, no questions. They can see you. Still haven't seen you yet. I'm just gonna get up and walk around and walk back and back in.
Jennifer, I'm going to Pet Macy.
Okay. Tell her hi. Hi, Macy.
All right, looks like we're making our way back.
All right. So are you ready to begin?
Ready when you are.
I think I'm actually back on. Okay. So we're going to start off after the break with the regulations. And so this is just generally what we're going to be talking about over the next several slides. And there are two regulations that cover people who are subject to FTA testing. That's the FTA regulation, Part 49 CFR, Part 655. And what that talks about is who is subject to testing and when testing is required. So in other words, who's a safety sensitive employee and at what point in time do you have to test those employees? Part 40 kind of goes into the process of testing. So that's the DOT regulation. That covers all the modes. So that tells, so in other words, a DOT collection for an FAA employee is the same as a DOT collection for an FTA employee, is the same as a DOT collection for a pipeline employee. And the reason that each mode has its own regulations, such as 655 for FTA, 382 for FMCSA, is because there is a difference in what it would be considered a safety sensitive function, a safety sensitive employee. So a bus driver is different from an airline pilot. A flight crew member for FAA is different than a maintenance worker for FTA. So there are different situations also when you would get tested. So in other words, it's different from testing a pilot who you can't just stop the vehicle and test than it is for FTA. Coast Guard also falls under the DOT regulations, even though they're Homeland Security. So the vessel that may be out in the middle of the ocean is different from doing a random test and doing an FTA. There's also differences in things like accidents. And an accident for a rail is different than an accident for a bus. Different for an accident for an airplane is different than an accident bus. So each one of them has their own regulation. I'm sure you've read them all, 655, and memorized it as I have. And Part 40 also is for DOT. And like I said, that tells what does the collection site do? What are the roles of the SAP and the MRO, that type of thing. And those are the same across all modes. Okay, so now I want to talk about applicability. In other words, who has to have a drug and alcohol program? And FTA is different than all the other modes in that it's all about the money with FTA. So airlines, Delta Airlines doesn't get money from the federal government, but they must have a program. Federal motor carriers, all private businesses, they don't necessarily get money from the federal government, but FTA does. So the requirement is that if you get certain types of funding, you must have a drug and alcohol program for FTA. So if these are the types of fundings we have listed here: 5307, 5309, 5339, 5311, which is rural funding. And even if you look in the FTA frequently asked questions concerning COVID-19, CARES Act recipients are required to have an FTA drug and alcohol program. Now, those will primarily be the employers who have received, or FTA grantees who received the funding sources above, but not necessarily. There are cases where someone who had not received any of those four types of funding will receive CARES Act money. And at that point in time, what the regulation state is, they're required to have a program. So subrecipients and contractors of an FTA grantee must also have a drug and alcohol program if they provide a safety sensitive function. Okay, even if a grantee says, well, we run we get money, we have a fixed route bus, we don't have any of that money go to the paratransit operation. It doesn't matter. If you are receiving operating funds, it's like a big umbrella. It covers any safety sensitive function you perform. So even though you may say that we differentiate the monies that go to that contractor or that other service, it doesn't matter. Once they perform a safety sensitive function, they're covered under FTA drug and alcohol regulations. And as far as capital funding, you can segregate that funding. So if, for instance, you only receive capital funding and you've purchased 2 buses with that, only those employees who perform a safety sensitive function involved with those 2 buses would be required to be in the program. Now, these are employers who are exempt. So maintenance contractors are exempt from drug and alcohol testing requirements as long as they're a 5311 grantee, so they're a contractor for a rural carrier, or for any of these other types of funding if they're serving an area of less than 200,000. Also, anyone who's on a maintenance contractor who operates on a limited or ad hoc basis. In other words, if you send your vehicles occasionally down to Jiffy Lube for an oil change, Jiffy Lube does not have to have a program. You don't have a contract with them. You kind of send it kind of as needed, but there's no agreement. Or if you send something to someone for a one-time basis, but really it has to do with if it's regular, if it's contracted. If you have a ferry boat, which I'm kind of doubt that Missouri has any ferry boats, but if you do, they're mostly covered by the Coast Guard, except if you are a ferry boat and you receive FTA funding, and you carry passengers, then you still must do FTA random alcohol testing. And the reason for that is Coast Guard does not do random alcohol testing. So in order to be consistent, FTA said ferry boat operators must do FTA random alcohol testing. Now, one of the big issues coming up, and it's going to become a bigger issue down the line, is all the shared mobility, Uber, Lyft, Curve, Via. There's probably several others that I'm not aware of right now. But people ask, does testing requirement apply? So in other words, if we use Uber to, to pick up people at after our operations no longer operate at midnight, we use them to pick them up at train stations and things like that. Yes, that applies. So they're performing a safety sensitive function. They're operating a revenue vehicle, the revenue vehicle being their car. So in other words, the rules applying to all employees of contractors performing safety sensitive function. And then there's something called a taxi cab exemption. What the taxi cab exemption says, and this was written for taxi cabs, it was before Uber, Lyft, Curve, Via, all the rest of them existed. This was written back in the 1990s when the regulation was written, is that if someone can come out and just hail a cab and get in the cab, but you can use a voucher, then no, that cab company does not need to have a drug and alcohol program. In other words, if the choice is up to the patron or the passenger. And the reason for that was to keep places where they had several cab companies and someone could call any of them and they could use a voucher for part or all of their trip. They did not want every cab company in the city to have to do that. However, if you have an agreement with the cab company and the person does not have a choice, the person must go to that cab company or must go to Uber or must go to Lyft, then yes, they are required to have a drug and alcohol program. And then at the end here, it says, what if funded with public transportation innovation funds? And the answer is no, they don't have to have a program. Okay. Even if the recipient receives 5307, 5309, 5311, they don't have to if they're totally, if the only funding they get is the 5312. So we're going to talk a little bit about safety sensitive functions. Like I said, I was just at a TSI training in Denver, and there was a lot of discussion about what actually is safety sensitive function. And it means, and I'm going to give a list here, any of the following duties when performed by employees of recipients, subrecipients, operators, or contractors. So if they perform these functions, they're considered a safety sensitive under FTA. One being operating a revenue service vehicle, including when not in revenue service, okay? So revenue service vehicle, what are those? Basically, the vehicles you use to carry passengers. Public transit vehicles used in providing transit services for passengers carries passengers that directly pays fares, are subsidized by public policy, or provide payment through some contractual arrangement. Includes vehicles operated in free fare service which carry passengers. So even if the person doesn't pay for it, if they don't, there's no fare collected, that is still considered a revenue service vehicle if you're carrying passengers. Okay. A non-revenue service vehicle when required to be operated by a holder of a commercial driver's license. Okay, a vehicle used in connection with keeping revenue vehicles in operation, such as a tow truck or snowplow. We sometimes also call these ancillary vehicles. And there's one more on that list, and that would be a security car. So non-revenue vehicle, well, it doesn't apply here because this is for CDL, but that is part of ancillary vehicles. So these are basically, this is a category of basically, and FTA has come and specifically mentioned two types, snowplow and tow truck. So in other words, if you have snowplows and tow trucks, and they're the vehicles that require a CDL to operate, and they service in and around the transit operation. So in other words, they plow the transit operations or they tow the transit vehicles, then they are considered, then those operators are considered safety sensitive also. Okay. It's probably, of all the categories of safety sensitive service, that's probably the more gray area one, the one that's more difficult to understand. Other one is dispatches, controlling dispatch or movement of a revenue service vehicle. And FTA said that controlling movement includes communication concerning specific detail and contemporaneous route turn instruction to individual operators. So what is not controlling movement? Not safety sensitive. Call taking, scheduling, assigning routes, function performed by operations supervisors such as day-to-day management. So in other words, if someone says, I create the routes, that's not considered safety sensitive. If someone says, okay, Joe, go left on Elm and then take a right on Maple, that is safety sensitive, okay? Because what was happening is, and FTA has come down and kind of more clearly defined this, because what was happening is people were throwing all safety sensitive, we were throwing a lot of people into the dispatch employee category with the idea that, well, they create the route, so therefore they are dispatch. They create the schedule, they hand someone the keys, they assign the routes. That's not it. It's more of a day-to-day, as it says, contemporaneous route turn instruction to individual operators. So someone who actually controls the vehicle where it's going. Even if someone who points to the vehicle, go left, okay, you've instructed them the actual movement of the vehicle, but not someone who's more in a management position who creates routes, schedules routes, things like that. That is not considered safety sensitive. The fourth category, maintaining a revenue service vehicle or equipment used in revenue service, includes repairs, overhaul, and rebuilding, does not include maintenance supervisors who approve maintenance work. And again, FTA is trying to get away from crowding the random pool with all these people who do not, on a day-to-day basis, actually perform a safety-sensitive function. So in other words, the maintenance supervisor comes down but doesn't actually ever turn a screwdriver, turn a wrench, but just looks, checks the box and says, yes, the work was done. That is not someone who's considered safety sensitive. It's the person who turns the wrench. It's the person who uses the screwdriver. Okay, that was the intention of this. Carrying a firearm for security purposes, transit police, private security firms. So these are people who provide security function in and around the transit operation. So transit police, private security firms. What about armored car personnel? FTA just had a newsletter article on that actually, and what they stated was that if armored car personnel actually go through the transit operations where the passengers are, then yes, they could be considered safety sensitive. If they just go to the remote office to pick up whatever, the tokens, the money, whatever, then no. If they're not in and among the transit public, then no, they're not considered safety sensitive. What about local police? If local police are assigned by the police to be at the transit station, then probably not. Local police are considered safety sensitive only if their actions are controlled by the transit's employer. So in other words, if they can be pulled off the transit operation because there's something going on and transit operations has no say in it, then no, they're not considered safety sensitive. Only if they're under the direct control of the transit employer. So would they ever be considered safety sensitive? Okay. Local police typically aren't, and local police usually fight also if they are considered safety sensitive because they don't want to be in the testing program. So safety sensitive employee must have a verified DOT and pre-employment drug test result, okay? So you cannot perform a safety sensitive function unless you have a verified negative DOT pre-employment drug test result, whether it be during COVID or not during COVID, okay? Must be in a DOT random testing pool. So once you receive your verified negative DOT pre-employment drug test result, you go into the random pool. And they're subject to DOT random post-accident and reasonable suspicion testing. And they must receive 60 minutes of training on the effects and consequences of prohibited drug use. Okay? So safety sensitive employees must do all those things. Now, who is not safety sensitive? And if they're not safety sensitive, they're not subject to the drug and alcohol requirements. Those employees who do not or will not perform a safety sensitive function. So what we've seen, and that's why FTA has come out and taken kind of a hard stand on this, is supervisors or management who will not perform any FTA-defined safety-sensitive function are not considered safety-sensitive. So just because someone manages safety-sensitive does not mean they are safety-sensitive, okay? Even though they may supervise safety-sensitive functions or safety-sensitive employees, they are not considered safety-sensitive. A DAPM, DER, if they will not perform a safety sensitive function, is not considered safety sensitive. We see a lot of places that say, well, they're the supervisors, so we think they should be in with all the employees because they're the ones who are kind of informing them to go for randoms or making a decision about post-accident, so we think they should be in there too. And the answer is, those things are not considered safety sensitive functions. Maintenance supervisors who only approved maintenance work, we kind of went over this. Any employees who only perform an FTA-defined safety sensitive in an unusual emergency. So sometimes we'll see that. We'll say, well, no, our managers will drive the vehicles in case of an emergency. And we'll say, okay, when was the last time that happened? And they'll say, well, there was a hurricane like 7 years ago and they drove. They moved the buses. I said, well, that's not really safety sensitive. Do you really want them in your random pool being selected rather than the operators, rather than the maintenance people to go for a random test when they're actually on a day-to-day basis, not even on a regular basis, performing a safety sensitive function? So FTA came down on that and said, no, supervisors who may, if there's a volcano in Iowa, move the vehicles, they are not considered safety sensitive. The question you should ask is, do they ever perform, in reality, perform a safety sensitive function? And they do, and do they do so on a regular basis? So it's an issue with FTA to properly define safety sensitive so as not to dilute the random pool. All right, program requirements. The policy, my favorite subject. So what is a policy? Everyone's required to have a drug and alcohol policy. Every employer who is subject to FTA drug and alcohol regulations. The policy is one of the requirements. And it's basically a statement describing the employee's policy on prohibited drug use and alcohol misuse in the workplace. Okay, so you want to tell us what you would do in certain situations, but you're not just telling us. The purpose of the policy is to tell the employees what will happen. What will happen if they get a positive? What will happen once they become an employee and they are subject to testing? When could they be tested? What happens if they go for a test? What happens if they get a non-negative? What's going to happen to them? They need to know that, okay? But it also tells the DAPM what to do in certain situations, because to be quite honest, a lot of situations only occur occasionally. And the DAPM sometimes needs to go to the policy and say, what's our policy in doing that? But as it says there, informs employees of actions that are prohibited by FTA and DOT. Now, you should already have trained them that, no, you can't take heroin and drive the bus. However, this should also state that in the policy. Describe circumstances for testing, describes consequences for rule violations, whether it be that you had a 0.02 alcohol test result or you had an actual violation of 0.04. Now, how do you get a policy? Well, FTA has the policy builder tool right here. There's a link to it, and it's a pretty good tool. And what it does is you go in line, you click on it, And what it's going to do is ask you, I think, 7 questions. You're going to put in those 7 questions like, what do I do if there's a dilute negative? Do I retest or do I accept a negative test result? Do I have a second chance policy? It allows you to put in drug-free workplace information. So it asks you several questions. It then generates a policy which is compliant with FTA, okay? So if the auditors come online and you come on site and you have your policy builder policy and you haven't revised it to put in all kinds of stuff that is now not compliant, then they'll come back and say, yeah, that's a good policy. And it's a very short policy, about 7, 8 pages long. And I need some water. So that's a great tool if you just want a simple policy. However, it will generate it in Word. So if you wish to add things in about prescription over-the-counter drugs, which isn't included in here, if you want to put in if you want to put in some other employer issues in the policy, you can do that. All we recommend, or actually require, is that if you have DOT requirements and employer requirements in the same policy, that you differentiate between them, usually using a different font, one bold, one not bold, one red ink, one blue ink, that kind of stuff, so that the employee who reads it knows when they're talking about what is required by DOT and knows what's required by their employer. Okay. There's also sample policies, Appendix A to the Best Practices Manual. Do not try to read the whole Best Practices Manual. It's about 700 pages, I think. But Appendix A has about, I don't know, a dozen, 15 sample policies for all different situations. It has one for rural. It has one for large transit systems. It has someone who has a contractor. It has someone who is also have FMCSA covered employees, that type of thing. So it has quite a few different, go in there, cut and paste, copy, say you wrote it, that's fine. That's how we got them. But there, if you don't want to use the policy builder, then the appendix is a real good tool to use. Gives you a lot of sample text that we approve, so use all the right words and everything. Now, it was created in 2009, so there have been some slight changes in policy requirements. However, they're about 97% good. There may be a couple little tweaks in there that would be required for you to have a completely compliant policy. However, it'll give you a really good head start. So those are both out there, and they're free of charge, of course, because you've already paid for them.
Mike, just as an aside, I tested that link is not loading at the moment.
The policy builder?
Yeah, the appendix.
Oh, the appendix, okay. Yeah, I had my appendix out when I was like 18, so.
So just as an aside.
Yep. Okay, we'll have to double check on that.
Yeah, but
Yeah.
To the attendees, if you go to our website,
Yeah.
you can, I think it's laid out pretty easily to find stuff. So
Yeah.
so know that even if these direct links don't work, you should be able to find that stuff. If you have any trouble, you can email the hotline.
Yep.
And we can send you the updated link.
And the best practices is easy to find. It'll be in the technical assistance, or no, it'll be in the publications area. Yeah. And then once you get into the best practices, it's near the end. So you should be able to find it fairly easily. The next requirement we're going to talk about is education and training. So there is a requirement that all safety sensitive employees, and remember we already went over who's safety sensitive, are required to do a minimum of 60 minutes on drugs. And that's in 655.14B. You can use that, a little bit of knowledge. And what it says is that you must train on the effects and consequences of prohibited drug use on personal health, safety, and the work environment, signs and symptoms. Additional training does not count towards the 60 minutes. So in other words, 60 minutes on drugs is a one-time training requirement for any employer that you're with. So in other words, right now, FTA does not have any retraining requirements, but all safety sensitive employees must go through 60 minutes of training on the effects and consequences of prohibited drug use. Okay? And again, there's no time frame stipulated in the regulations as to when you have to have that done. We like to see it done within the first 3 months that the person has been employed in performing a safety sensitive function. However, it's really preferable that the person have that training as part of their kind of new employee training before they actually provide a safety sensitive function. However, it does not state that, so we would not hold you to that. Okay, so 60 minutes of training, safety sensitive employees. And once again, there's a video, our tool. So FTA, we would go on these audits and we would find out that no one was doing very good training. It was really kind of, so it was constant finding that they're conducting training. However, the training they're conducting is not compliant with the regulation 655.14B. So FTA came up with its own video. And I must say, it's pretty good. It meets the 60-minute requirement. I think it's 65 minutes. And it's online and it's free and it's easy to give your employees, whether you want them to watch it at home or, you know, gather around the laptop or whatever and work. But however, just document that the person, there will be nothing at the end. There's no quiz. There's nothing that prints out or anything like that. Just document that you were aware that the employee went through this training and that they did actually not sleep through the whole thing. So but it's a very good video. It's actually interesting. It's FDA did a great job of putting together the video. So that's the easiest tool you can use to meet the 60-minute training. Again, just document that these people viewed the video on this day at this time, and I'm signing it as their supervisor, and that'll be good enough for any of the auditors coming in saying, okay, yes, you're providing this training. So the other training that's required is reasonable suspicion training. And it says supervisors, but it's really any company official authorized to make, that you want to authorize to make reasonable suspicion determinants must receive 60 minutes of training on the physical behavior and performance indicators of probable drug use, and 60 minutes on physical, behavioral, and performance indicators of probable alcohol use. So in other words, 2 hours of training, okay? And this is only for people, this isn't for every safety sensitive, this is only for people that you want to be authorized to make reasonable suspicion referrals, okay? So you need to make that choice, who's gonna do this. Some people do it to all their supervisors. Others use other individuals. It's whoever you feel. Training must occur prior to making any reasonable suspicion referral. So in other words, unlike the other training where someone could perform a safety sensitive function, you cannot make a reasonable suspicion referral until you've undergone this training. And FTA does also have a video here, but it's not nearly as good. And it was created, I think, around 2002. So everyone's dressed real weird and they have strange clothing on. And you know, they show trains and buses that look like they're 20 years old. So it's a very old video and it doesn't even come close to meeting the 2-hour requirement. It's, I think, a 28-minute video. It does come with some materials which you could use to probably meet about half the training, but you still have to come up with something else to meet the other half of the training, okay? And it does have to be 60 minutes drug and 60 minutes alcohol. So don't do 65 minutes in drug and 55 minutes of alcohol, because we'll come back and say, no, that's no good. And as far as the previous training, it's 60 minutes of drug for all safety sensitive. So when we come in on an audit, I always say to the person, okay, do you do 60 minutes of training? Yes, we do. What do you train on? Well, we talk to them about drugs and alcohol. I said, well, you just lost, because it's 60 minutes on drugs. So alcohol is not included in the previous requirement for all safety sensitive employees. You can do it if you wish to, but it's in addition to the 60 minutes. Here, you have to do 60 minutes on the behavioral and performance indicators. In other words, what does someone look like? What are the signs and symptoms of drug use? What are the signs and symptoms of alcohol use? Which, to be quite honest with you, 60 minutes on signs and symptoms of alcohol use is really difficult. But it's a requirement. So there are a lot of tools out there. There are a lot of private organizations. Qatar in Florida does one. that have a very good video, CUTR. They're with the University of Florida, I believe. They have a very good video. And also, I'm trying to think, there's a couple more out there. But Cutter has a good one. So if you look up reasonable suspicion videos, you will online, you will see some. Like I said, FTAs, it's one of the things that we're thinking of redoing right now. But it will meet part of the requirement, and it certainly meets 50% of the requirement, but you'd have to come up with another 50%. Okay, so that's the training requirements. And again, they're both one-time training requirements. Once you do that requirement, you are not required with that employer to do any retraining. When I run FTA, we're going to put in a retraining requirement 5 years down the road, I think. One other thing that it says company officials and supervisors, you should determine who is actually trained for reasonable suspicion. Think who is in contact with your safety sensitive employees. We've gone to places and said, yeah, all our supervisors, all our management has been trained. I go, you mean the management that sits in their offices up here on the 4th floor and have never been in the bus garage in their lives? So you want to make sure that it's the people who are down near the safety sensitive employees. Dispatches are great. Usually people have to come up to the dispatches, the operators and such. Maintenance supervisors who are in the garage are great. So you want to make sure you have the right people trained in reasonable suspicion. You also want to make sure that people know who is trained in reasonable suspicion. So that if someone comes up, we had an instance where someone came up to the dispatcher's window and they said they could smell alcohol about 20 feet away. They had no idea who to talk to, and they didn't stop the employee. So the employee turned around, fell down, and then got up and got on their bus. So we'd rather not have that happen. So make sure that people know who to contact if there's a reasonable suspicion situation. Okay. So prohibited substances and behaviors. Okay, what are the prohibited substances? So these are the drugs that DOT tests for. All the good ones: marijuana, cocaine. I'm just going to say PCP. Opioids, and that includes all these. So we see the ones down there: OxyContin, Percocet. But these are the kind of I guess the street names or the names that people know them by: Percodin, Percocet, Vicodin, Lortab, Norco.
Brand names.
Now, Jennifer, how many of those have you taken?
I did get, I'm trying to think, I had surgery earlier this year, so I'm sure.
Well, we don't need to know about that.
But yeah, those are the brand names. I'm not sure.
So those are the brand
about
names.
The street names might be.
No, the streets name. That's true. That's true. I haven't been on the streets in a while. Yeah.
You hung that crown up.
Yeah, I'm got to get back to Chelsea. So these are the 5 main categories: marijuana, cocaine, PCP, opioids, and amphetamines, and some of the sub drugs within them. Well, there is a study going on right now and a proposal to add benzodiazepines to that. So we'll see how that goes. Like I said, there's always a lot of things going on. Like I had already talked about oral fluids, but also benzodiazepines, and including them in this is also something that's being kind of reviewed and researched, actually, as far as and even if it's for, I believe a proposal has been made to test, to have a different test, just as FRA does for accidents, for after an accident, especially after a serious or a fatal accident. FRA does additional testing that they don't normally do for random for after accidents. So there's been some proposals for FTA to do the same thing. We'll see if that happens. But these are illegal use of these drugs, and they're prohibited at all times. And they're illegal because even those that are available by prescription, we're talking about people who are not using them either with prescription or legally. Okay. So these are all the good drugs we test for, and it's always been 5-panel. And even when they added in OxyContin and all that, it would just went under. At the time, it was opiates. It was actually changed to opioids because opioids is the natural substance. Opioids includes the semi-synthetic substance. So opioids is more inclusive, and so that's why the change was opiates to opioids. That's only something like the drug and alcohol testing geeks kind of are aware of, but we had a lot of conversations about that. So now, FTA drug and alcohol, just remember, DOT FTA drug tests may occur at any time a safety sensitive employee is on duty. Okay? Even if not currently performing a safety sensitive duty or performing a safety sensitive duty that day. So if someone who is a safety sensitive employee and they're an operator, but that day they're doing admin tasks, they come in, they can still be tested for drugs. Okay? Even if they, let's say, work occasionally, as I said, don't put supervisors in the random pool. They don't classify them as safety sensitive. If you have someone who just does the occasional safety sensitive and you classify them as a safety sensitive employee, they can be tested anytime on duty, even if they haven't done a safety sensitive function within the last 3 weeks. So that's another issue with who do you actually want in your random pool, in your random pool. Okay. So this also includes DAPMs, and we always get a question, well, what if the DAPM is on the random list? So the DAPM gets the list and they're on it. What do? Well, if the DAPM gets the random list, let's say it's a monthly list and they open it up because they're going to start scheduling random tests. If they see their own name, they need to stop what they're doing and go for a test immediately. Okay, so even if that means that they're scheduled in 10 minutes to go daycare pickup, I'm sorry, they have to go for the test, which is a 20-minute drive away. Now, the other thing they could possibly do, which is allowed, and which is actually a preferred method, is that if the DAPM is going to be on the list and the DAPM is the one that gets the random list, it would go to another person, possibly their supervisor or someone else who works in that program with them. That person would then have knowledge that they were on the list and they would schedule them for a test when they felt like it, when they determined it. So the DAPM would not know when they were going to be selected or when they were going to be notified. And so the person who received the name would just walk up to them one day and say, it's time for you to go for a test. Okay? So in other words, treating them like any other employee. So that is one way you get around a DAPM or a DER. But again, DAPM must go immediately once they are notified, and opening of the list with their name on it, that's considered notification. Prohibited alcohol use. There are a few more rules with alcohol because alcohol is legal. So FTA doesn't really care if you do drink when you're not performing a safety sensitive function. So alcohol use is prohibited while performing a safety sensitive function within 4 hours to performing a safety sensitive function, and while on call to perform a safety sensitive function. However, on call, since we've been told by some employers that our employees are on call 24 hours a day, 365 days a year, and it's not FTA's intention that they must give up alcohol for the rest of their life, does allow employees the opportunity to acknowledge alcohol use. So let's say they go to Brother Joe's house for the barbecue, they're on call and then they get called in. If they had a few beers, they can say to their supervisor, hey, I had a few beers at my brother's barbecue. Now, if they still want to go on and drive, that's up to them, but now they're subject to reasonable suspicion testing, okay? But they must be given the opportunity to acknowledge alcohol use and say, I don't think I'm fit to drive because I had a few beers at the barbecue, okay? Alcohol use also prohibited within 8 hours following an accident, requiring the FTA post-accident test until the test has been conducted. So that's obvious because and then really what that is all about is if someone is in an accident and they need to receive medical attention, they need to go to the hospital and get stitched up or something, and that's going to take 5 hours, they can be tested right after that. But while they're waiting or something, they certainly can't drink alcohol. Okay, so it's different whereas drug use is anytime on duty and it's always prohibited. Alcohol has these kind of time frames when alcohol use is prohibited. And one thing that we find not a lot of understanding of that is alcohol test may only occur just before, just after, or during the performance of a safety sensitive function, except for pre-employment. Okay, and that's outside of the 4-hour time frame we saw prior to performing a safety sensitive function. Okay, so you can't test someone if they're not performing a safety sensitive function that day. Okay, so again, use the same scenario where the person is a driver, they're doing admin that day, you cannot alcohol test them that day for DOT. Okay, maybe company policy that you can't drink during the day when you're not performing a safety sensitive function or when you're on site, but it's not FTA policy. So if someone is doing admin that day, but they are a driver, and they just doing admin functions, and they decide, and you know, Bob, who's been around for 37 years and is retiring, and they went out to the retirement luncheon and had the champagne toast, then you know what? You can't test them because they're not performing a safety sensitive function that day. Okay. Which I think makes sense. But we do get a lot of pushback on that, saying, FTA saying you can drink alcohol while you're on the job, and it's like, that's up to you. We're saying they can't drink if they are going to perform a safety sensitive function. However, if they're not, why would FTA get involved in the life of someone who is not performing a safety sensitive function? I don't think you want FTA there. Verified positive drug test. It's the specimen is sent to the lab. The specimen is sent to the lab and it tests positive at the lab. Now remember, the lab is not the collection site. A lot of people use the term lab when it's collection site. The lab is the big HHS certified labs that is like, you know, 10 or 20 of them around the country. I've actually been to one. They process easily 100,000 specimens a day. They're an unbelievable conveyor belts of bottles of pee going by constantly, and some marked with special tapes so that they know it's DOT, which, by the way, is the DOT has the largest urine collection program in the world. But so it's specimen test positive at the lab. The MRO performs the medical review of lab result, the laboratory positive verified by the MRO, and the MRO contacts the employee in the DER, and the DER must immediately remove the employee from safety sensitive. Must provide the employee with the name and contact information of at least 2 qualified substance abuse professionals, and then they must follow their policy. Okay, so that's how generally a verified positive works. Now there are other things involved here. We talked already a little bit about safety concerns and things like that. And there's also some concerns with, there's some time issues with the MRO contacting the employee in the DEI and the employee not getting back to the MRO and things like that. But given that this is a shortened presentation from the typical 7-hour presentation, I was not going to get into all that issues.
Mike, we actually have a question.
Yes.
An anonymous attendee.
Anonymous.
Anonymous, I know.
That's the name I usually use.
So the question is, we've always done testing on duty, but what if they were coming in for a driver's training meeting that day? Would that be considered an admin in FTA's eyes as they are being paid for the meeting?
So they're coming in for driver training. So they're on duty, so they'd be subject to drug testing, right? But they would not be considered, unless they're going to go out onto the vehicle, they're not going to be considered a safety sensitive function, no, for alcohol testing.
Okay. Because if that doesn't answer your question, put it in the chat box or send it again. But,
I mean, I'm making the assumption that they're on duty because they're coming in for training.
That's how I'm reading it.
I mean, I wouldn't go in for training if they didn't pay me.
No?
No. What, you do?
I'm here on my own free time.
Oh, that's true. That's true. I forgot that.
Okay, so hopefully that answers your question. If not, send a
Resend
follow-up.
it. Yep. Okay. So now these are the confirmatory cutoff levels. I don't usually put these in the presentation, but I kind of find them a little interesting. And so this is what the confirmatory test is. The second test. There's actually an initial test for every specimen sent to the laboratory, the big places that handle the hundreds of thousands of specimens. Okay, so and that's kind of a larger general test. This is a more specific test. So this is what determines, once it gets by that first level, whether it's a positive or not. So does it meet or exceed these levels? Now, one thing you can see here is nothing is zero. So in other words, they're allowing you to have a certain amount of this substance present. So that's where we get back to Elaine and the opioids, which of course we knew we were going to do that. So see, that's why you can eat poppy seed bagels and it won't be a positive test result. Now, if it was zero, probably would be. And in the beginning of this program, some of these were actually zero, and then they went up. They realized that that was a mistake, that people were testing positive for things that, well, they really shouldn't test positive for. So then they went up higher, but as the science gets better, they've actually brought these down. And the science is always getting better. So the detection of these elements and being able to determine that this is actually use and not just, I'm sitting on the, in a small room.
When you go to a concert and, other people doing things, this covers that as well.
But, you go to the Grateful Dead's final tour, the 17th one, and you sit in that crowd, the levels are high enough that even though you were sitting all around people smoking, you're not going to have that in your bloodstream to that extent, or it's not going to be in your urine to that extent, I should say. Okay, so that won't be detected. So that's why these are not at zero levels. Okay, so there is a little leeway here, and there is an assumption that people can have some things in their system despite not using them. So it's a protection for the employee. You got to remember these regulations are a balance between employee rights and deterrence. So this is considered, employees should be able to live their life and not have to run away because their seat happens to be in, the pot zone kind of thing, right, at the concert.
But it's not saying that only a little cocaine is okay.
No, it's not. It's not. This is however, we have had people who have used medical codeine and things like that. But again, typically what happens there is there's a prescription. I remember we had one where a person who was given, they were actually given codeine on cotton balls to put up their nose because they had broken their nose. And then the next day they actually tested positive. So because he didn't have a prescription, he actually had to go back to the hospital and say, tell them that you put cocaine balls up my nose. So these things do happen, okay? Mm-hmm. And FTA is aware of it, so they're not so strict. But they're low enough to detect use of these drugs. And again, science is getting better all the time. That's one reason why oral fluids is now an issue, is because they've made the science so much better. They've become better at this, that now they can. A few years ago, oral fluids was not a consideration because it just was not there. The reliability wasn't there. Now it is. And again, at some point in time, hair testing will happen too, probably within 3 or 4 or 5 years. They've been working that in a while, but the science is increasing quickly, and so we're seeing things like this. So here's some more semi-synthetic opioids, PCP. Okay. So confirmatory levels are lower than the initial screening levels. So the initial screening levels will kind of get out the majority, but then it goes on to a second test. Okay.
So go to the concert, eat the poppy seed bagel.
Yeah. I mean, you want to keep carbs low anyways, but so limit maybe 2 bagels.
2 bagels.
But you won't have the Elaine situation occur. So confirmation test results greater than or equal to 0.04. As everyone knows, and I'm actually always surprised when I talk about this, people don't realize that there are actually two tests for alcohol. There is the screening test, and if it's greater or equal to 0.02, requires a 15-minute wait and then a confirmation test. Okay? So the confirmation test, if it's greater than 0.04, that's the magic number. You now have a DOT violation. Okay? If it's between 0.02 and 0.04, then you need to be taken out of safety sensitive function for a period of 8 hours or until you test lower than 0.02. But no one actually does the second test. Everyone just pulls the person and says, come back tomorrow. But there is no violation as far as DOT is concerned. If the employer, though, a lot of times will have ramifications for having a test result between 0.02, 0.039. We suggest that you put that in your policy, but that's up to you. That's your ramification. That's not FTA's or DOT's ramification. Yeah, so if someone does test 0.04, remember it's happening right there. It's not going to the lab. So the BAT, breath alcohol technician, should call the DAPM immediately and say, hey, we have a test result more than 0.04. The employer must not allow the person to continue safety sensitive function. This is different from a drug test where you may get the test result 3, 4, 5 days later. And if the person could actually be performing a safety sensitive function at that time, you need to go pull them off. But with alcohol, they're there in the site, so you can do that, okay? And remember, 15-minute wait, and remember also when someone goes in for an alcohol test, go immediately, okay? Sometimes we see the BATs will say, oh, we give them 15 minutes in the waiting room because if there's anything in the mouth, we want it to clear away. Do not do that. That is not the proper procedure. That is what the confirmation 15-minute wait time for the confirmation test is for, to clear out anything that may be in their mouth. And it will do that.
Would that be like mouthwash and that sort of thing?
Yeah, mouthwash is the typical one. Someone once brought up rum candy, but I don't believe that. I'd like to see. We actually had, and I'm interested in if anyone here has had that situation, let me know, because I'm going to be checking with the person at VOLPE who actually tests every single EBT that is used by DOT, which is the great Ed Condi. And we just heard someone when I was at the training in Denver, at TSI training, say that they were not able to use their EBT because of all the hand sanitizer.
Oh.
Because the whole room was sanitized and everyone's hands were sanitized. And I'm just surprised to hear that. And everyone in the room was kind of stunned. And they said, why don't you calibrate your EBT? And she said, we did. And then we used even a second EBT and the same thing happened. So I've not heard that. And that would be something that would have been, talked about quite a bit by DOT. So I'm just kind of wondering if anyone else has had a similar situation. But that's the first time I heard it, and given the fact that this has now been going on for about 6 or 7 months, I was surprised that. So everyone came to agreement that she should send it back to the manufacturer for repair and calibration. But I will check I'm going to check with the guru of the EBT, and that may even appear in a future newsletter. So there's a lot of refusals to test. FTA, DOT keeps adding them. So there's a couple of pages here. Now, the only thing I'm going to go over is the ones that appear in red, which say, and those are the ones that may not apply because of pre-employment testing. Now, remember, pre-employment refusals are not the same as other test refusals. So in other words, if you fail to appear at a testing site or a collection site for pre-employment, it is not a refusal. Okay? Because you're not yet an employee, and we always use the example, okay, I'm job hunting, I've got 4 or 5 resumes out there, I go and interview with the transit system, they say, on Monday, they say, come back Wednesday and go to the collection site for a reasonable suspicion. Well, I get home and I got an offer about 3 times better than that, of course. And so am I gonna go to that collection? Yeah, it does, I mean, sometimes it's too much money. So is that then a refusal, the fact that they did not show up on Wednesday? Why would they show up when they've already accepted the other job, right? So did they fail to appear? Yes, they did. Was a pre-employment test scheduled? Yes, it was. However, FTA came back and said, that's not a refusal. So the difference between a refusal for a pre-employment and other test is basically the time the test starts. With every other test type, it's when you were notified. With pre-employment, it's when you take the specimen cup. So you're already in there, you've already signed in, you've already waited, you've already been brought in the back. They've said either given you a specimen cup or said you choose one. Once you touch it, if you now put it down and say, no, I'm not gonna do that, it's a refusal. Same thing with the mouthpiece for alcohol. So they give you up until that time for pre-employment, okay? For the same reason, because if you walk out of there, or even if you show up and you do it and decide, you know what, who wants to work in transit? And they walk out the door. That's not a refusal. They never started the process and they're not already an employee. So that's the difference. But you might want to look over all these refusals. There's quite a few of them. They get into a lot of things. The thing at the bottom here, refusals are determined by the MRO or the employer. So remember, a collector will not determine a refusal. A collector will tell the employer what happened, and the employer can determine or can call it a refusal. But a collector will not say, this person refused. They will call up the DER, the DEPM and say, this person walked out of here. And then the employer will say, it's a refusal. So it's not up to the the collector to make that determinations. And refusals have the same consequences as a positive drug or an alcohol test result greater than 0.04. All right, pre-employment testing. There's 3 situations where you do pre-employment: applicant, new employee, current employee transfers to a safety sensitive, current non-safety sensitive transfers to a safety sensitive, and a current employee returning from extended leave where they haven't done any safety sensitive duties for 90 days and removed from the testing pool for 90 plus days. Okay, so those are 3 situations where you do pre-employment testing. So it's not just new employees. It's also people who have not perform safety sensitive functions or haven't done it in 90 days and are out of the random pool. So DOT drug test required for all FTA safety sensitive positions. You must get a negative test result prior to the first safety sensitive function. So we're going to move on to random testing, which is kind of the guts of the program. Choosing without method or conscious decision, so that's random. You need to create a random pool, which is all your safety sensitive employees. You can put all DOT covered employees together. So if you have FMCSA, you can, but typically we see FTA together. You must be maintained and up to date. So in other words, if someone leaves, if new hires, you wanna update the random pool before the next selection. Selections by scientifically valid method, no dartboards or anything like that, typically software. Excel is fine. You want to use Excel random number generator, that's okay, that's fine. You don't need some fancy piece of software that's going to cost you an arm and a leg, and you don't need
plenty of free software.
Yeah, you just put in random number generator and you'll get about 8 million hits. Also, you don't need a TPA. You don't need a third-party administrator to do your random selections or maintain your random pool. Okay, there is no. I was in Denver again. We had 19 people, I think. There, 3 of them thought they were required to have a TPA do the random selections. You were not. Okay. Testing rates, we already know 50% and 10%. We talked about that. Select a sufficient number to meet or exceed the minimum testing rates. So if you're falling behind a little bit, you can do a few extra names at the end. We always suggest doing a few extra names in the beginning, just to get above it. Testing above minimum rates is allowed. You don't need to have it in your policy. You want to test at 100%, go right ahead. And you have to be able to test all employees selected. You may not be able to test all employees selected, terminations, vacations, extended leave, and everything. Document, 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 okay? So random selections have to be at least quarterly. Once new random selection list is generated, the previous list is null. So if you haven't tested someone on that list, then you must not test them if the new list has been generated. Okay, so once quarter 2 list is generated, quarter 1 list is now null and void.
Right.
So you can change up the number of selections each period. You don't have to do 10, 10, 10, 10. You want to do 8, 12, 7:14, go right ahead. I came up with one extra there, but that's okay. So you can do that. Okay, so it doesn't have to be consistent. If you're in a consortium with other employees, each employer does not have to test at 50 and 10, only the whole consortium does. So if you're 2 employees in a pool of 200, you may not have anyone selected for several years, that's okay. And a consortium can be, as again, multiple DOT agencies, but it can only be DOT federal tests together. You can't put non-DOT in with DOT people. Okay. You have to be able to do a random test anytime you perform a safety sensitive function. So if you run a midnight Tuesday night, you need to have a place to get a test done, and midnight at Tuesday night. You run on Sunday mornings, you need to have a way to get a test done on Sunday morning. You have to be able to spread reasonably. So in other words, we don't want to see half your test in January and the other half in December at the end of the year. Spread it across reasonably. Doesn't have to be completely spread, but reasonable. Days of the week, if there's a weekend service, we want weekend testing. Nice to throw in a holiday test once in a while. The day after Super Bowl, the day after St. Patrick's Day, those are all good. Hours in which safety sensitive, yes. Being a Boston Irishman, I can make fun of the drunk Irish on St. Patrick's Day.
How do you say in Super Bowl?
So hours in which safety sensitive functions are performed. So in other words, if you perform safety sensitive from 4 till midnight, we expect that you have the ability to get a test done, but also occasionally do early morning or late evening testing. Just because your admin hours are 8 to 5 and you only work 8 to 5 doesn't mean testing only works 8 to 5. So we will come on site and say, hey, you come in at 8, but how come there's no test before 8? And you'll say, well, I don't come in till then. Be like, well, you do a couple of times a year from now on. So plan that out and do that. Must be unpredictable. We see some places that always test between 1 and 3, all their random tests. No, spread it out. No discernible pattern. Early morning, evening, weekends, if safety sensitive functions, which we already talked about. All right, I'm gonna turn the light on for a second here. Just getting dark here.
Yeah, I had to move where I was.
So post-accident testing. So what is an accident? It's an occurrence associated with the operation of a vehicle in which one or more of the following occurs. Individual dies, individual suffers a bodily injury and receives medical attention away from the scene. Public transit vehicle is one of the following and incurs disabling damage. And if it's a rail, trolley, bus, vessel being ship, ferry boat, and is removed from operation.
Mike, we have a question about random pools.
Yep.
Can you combine DOT and FTA in the same pool?
Well, FTA is DOT. So you can combine FTA and FMCSA, FTA Coast Guard, FTA Pipeline, yes. Anyone who falls under DOT, you can combine together.
Thank you.
All right. So FTA defines vehicle as a bus. Yeah, okay, we already went over that. So post-accident testing criteria. So we're going to talk about medical treatment away from the scene. Now remember, the decision on all post-accident tests is on the employer's determination using the best information at the time of the determination. So when the supervisor goes to the scene, they make the decision based on what they know at that time, which may change, but the decision is meant to be made at the scene at that time. Not 3 hours later, not, oh, we're going to go back and take a look at the video. No, at the scene. You should not leave the scene without the decision having been made. So medical treatment away from the scene means an individual, whether it be driver of the transit vehicle, driver of the other vehicle, passenger of any of the vehicles, goes directly from the scene to receive medical attention, directly from the scene. Even if you think they're not hurt, they're just doing an insurance fraud. Even if they go to medical attention, then yes, they went to receive medical attention. If they get home and they talk to their attorney who said, no, you have a bad neck, and then they go to the hospital and you hear about it the next day, you do not test the person. They did not leave from the scene, okay? transported by any means. So if their cousin come by and picks them up and they say, we're going to the hospital, assume they went to the hospital.
Mike,
Jennifer,
are we still doing the cards, the post-accident cards? I know with
We-
COVID got a little delayed on that.
we are backed up on that because we don't have anyone in the office right now, but we will.
So just to the attendees, we actually have these great little cards that are a good reference guide, but usually we're able to send them out, in a matter of days. That's not the case right now since we're not in the office, but just know that that is an option later on.
Yeah, if you need any, just give me a call or call the hotline. And
Or email, yeah.
We'll send you out some.
Yeah.
And does not require verification by the employer. So in other words, if someone says they're going to seek medical attention, we don't expect you to be calling around to the various medical and hospitals and things like that, okay? So what is disabling damage? A vehicle cannot proceed under its own power without further damage, okay? So in other words, even though the definition says towing, it doesn't necessarily mean to be towed. If you didn't tow it, but it incurred further damage, that was a disabled vehicle. It's a vehicle that cannot be easily repaired at the scene, so headlights, turn signals, horns, tires, things like that are not considered disabling damage, even though you would maybe not drive them in those situations, and maybe you would tow them, especially for, let's say, tires. You're not going to change a bus tire roadside, you're going to tow it. However, that's not considered disabling damage. Requires towing or transport away from the scene by another vehicle, or they would receive further damage. Okay? So in other words, FTA did not want you testing for little fender benders and for things like, oh, we broke a mirror and that kind of thing. We actually wanted you to test when there was a substantial incident.
Okay, Mike, we got another question.
All right.
If you were to, and it looks like this is a scenario-based question.
Nice.
So.
I like these.
If you are transporting a client to a medical appointment and an accident occurs along the way, the client then asks their doctor to treat them while they're in the pre-scheduled appointment. Should you do a post-accident test if you are still within the testing window?
So they're going anyways.
Right.
And they're going to be treated for to be looked at because of the accident?
I'm thinking like they're on their way to a regular appointment and they're like, oh, it's an annual physical.
Right.
And they're
Well,
saying to
if
the
they're
doctor, oh, my neck hurts, by the way, I was in an accident on the way here.
Well, if they're seeking medical attention, treatment because of the accident, then sure, yes, I would do that. I would post-accident test, yes.
Okay.
Factors that do not trigger post-accident: dollar amount of damage, driver citation, insurance or company requirement, just to be safe, reasonable suspicion implications, at fault versus preventable. It doesn't matter if the driver's at fault, if it doesn't meet the criteria, if it's not, no one was injured, no one went to see medical attention, there was no disabling damage, no fatality, then even if they're at fault, you don't test under FTA criteria, you can test under employer criteria if you wish to, but it would be a non-DOT test. Okay. Who to test? If there's a fatality, each surviving covered employee operating the public transportation vehicle and any other covered employee whose performance could have contributed. So you must test the driver in a fatality. In a non-fatality, you must test the driver unless, and it says down there, unless the employee's performance can be completely discounted as a contributing factor. So you need to be able to have the supervisor say, when something has met the threshold, I completely discount the driver as a contributing factor. Okay? So the criteria is, yes, we test because it was a non-fatality, they met the criteria, but now you're going to say, but in this you have to document, I'm going to discount them because I know they were stopped legally and someone ran into the back. Something like that. Okay? And as always, you test any of the covered employees whose performance could have contributed. So if maintenance didn't tighten the tire and it flew off, you might go test the maintenance person. If dispatch sent you down a street where they said, don't send them down because there's ice on that street and the bus went sliding off the road, you might test the dispatcher. Okay? So the decision to test is made by the employer at the scene. It's key. We don't want decisions made away from the scene. Using the best information available at the time. Any and all information on site. Do not reverse decisions based on facts that may emerge later. So if you're sending someone for a test and then someone gets back to the headquarters and says, I saw the video, we could discount the driver, but they're already on their way, you already sent them, have them do the test. Do not change based on information that comes up later on. And always document, post-accident reasonable suspicion, you always document more than anywhere else, okay? So drug and alcohol test, when to test. For post-accident, it's always alcohol and drugs, most of them. And it's always alcohol first, because the alcohol will leave your system quickly. Drugs won't, okay? So alcohol tests must be conducted first. If no test within 2 hours, document, and then you cannot test after 8 hours because it's a worthless test at that point in time. And drug tests you have to do within 32 hours. And they give you 32 hours basically in case someone needs to go for medical attention or have been incarcerated during that time period. Reasonable suspicion. Test when reasonable suspicion that employee has used prohibited drugs or misused alcohols. Observation by trained company officials required. Only one official is necessary. So you cannot delay a test asking another trained official to make a judgment. You can certainly use a second one only if there's no delay in testing, okay? So what is it? When do you test? It's based on specific contemporaneous articulable observations. I have no idea what that means, but you got to test based on stuff you see right then. Okay, so if the guy's sweating profusely and also, bloodshot eyes and stumbling, those are the kind of things. So the decision to test must be documented. Very important. Signs and symptoms, and we do have a reasonable suspicion form, again, on the FTA website. And it's just a suggested form. There is no specific actual form. Now, who should be authorized to make a reasonable suspicion referral? I kind of went over this already.
What about slurring speech?
I
said, what was that about slurring speech?
know, I'm like Joe Biden here. Who should be authorized to make a referral? Company officials will be in contact with safety-sensitive employees, dispatchers, street supervisors, maintenance supervisors. So in other words, people who will be around the safety-sensitive people. And again, employees not authorized should know who to contact. We went over that already.
And those people should have taken the training you mentioned before.
Yeah. Reasonable suspicion testing when? Drugs anytime on duty. Same thing with alcohol. Only if observations are made just before, during, or just after the performance of safety-sensitive functions. Employees must proceed immediately to the collection site for testing. Good idea if you transport them, since you just said, we think you might be on drugs or alcohol. Okay? And the time limits are the same as post-accident alcohol. But there is no time limit for drug. I think they just forgot about it. So here's some places an employer can release drug and alcohol information only to certain people, to the employee with written consent, and also to anyone the employee wants you to release it to with written consent. So to state oversight, to a grantee, if you're a contractor, to any DOT agency and office of the secretary, to the DOT agency and office of the secretary, when required in a lawsuit or grievance, and requested by NTSB, that's typically in an accident investigation. So 40.25 is the previous employer records check, which means that you must get written consent from every applicant who's previously performed, or within the previous 2 years, performed a DOT performed on a DOT safety-sensitive position. So in other words, you need to get consent from that their previous employer will release information concerning any drug or alcohol violations. And it's in 40.25. Okay. So this is the information you request. DOT has a sample. ODAPSI and FTA both have a sample form. It's the same form on site. It's a good form. Use that. You can't go wrong. Remember, you need to have a separate form for each employer that you're requesting information. There's no such thing as a general consent to multiple employers. So the employee has to sign, if you have 3 previous employees, have to sign 3 different forms. All right. Now here is technical assistance. So this is the FTA staff here. We don't have Jennifer's number up here yet because she's the newest person. So we will have to revise that.
I'm off the grid. No.
What's that?
I'm off
Oh
the
no,
grid.
oh no, we're putting you on there.
So you could probably guess based on the other emails what my email is.
Yes, yes.
Kind of follows a standard.
Yeah, well, you know.
But honestly, I would recommend just personally doing the hotline because that way you know it gets to all 4 of us and whoever
Yes.
reads it first, I think is, unless you're really hankering to talk to someone specifically.
Yeah, I get that a lot.
Yeah, Mike gets the most direct calls, but I think the hotline is your best bet because you're more likely to get the most, you know, the 4 of us work different hours, so you're likely, you know, that's the most coverage is that hotline.
I get in around 6:30 and Jennifer drags herself in around 10, I think. So that's about, but the hotline is basically the 3 names under it plus Jennifer who will pick it up. So again, this is the FTA Drug and Alcohol staff here. You know, people think we have, I had someone say, well, in your call center, and I said, call center? What are you kidding? It's
You mean my office and the one across the hall?
4 people, and usually one of them's on the road either doing an audit or training or a conference. So it's like typically 2 people in the office at any given time. So,
Yeah. Occasionally it's 1. That has happened
Yeah,
before.
sometimes.
It's 1 person.
right now it's none. So, but
That's true.
but we still check the hotline quite a bit. So if you have any questions, either call us directly or call the hotline. That's fine. Someone will.
Yeah, or the email too. We're always
Yep.
monitoring.
And this is just the FTA website and kind of the things that are on there, an example of a lot of technical assistance materials that have been gathered over, 15, 20 years. So we went over some of them as far as the policy toolkit and things like that. So there's a lot of good stuff out there.
on there.
Yeah, there's a lot of good stuff out there. You can,
Yeah.
you
And
can
it's
put
all
together your
free.
program.
Yeah.
And this is ODAPSI's website, ODAPSI being the Office of Drug and Alcohol Policy Compliance within the Office of Secretary. Also a very good website, a lot of useful information there. And also you can find out what's coming on down the road for DOT testing a lot of times. So, and they also have numbers to call and they're helpful. They'll actually pick up the phone and talk to you. So, which a lot of, agencies just under the secretary level won't do, but they will do that. So this reports directly to the secretary, and they will actually pick up the phone and talk to you. And that's it. Stay safe, as we say nowadays. But thank you very much for whoever was online. I'm not sure, but I appreciate the time.
Thank you guys. Thanks for being here. Thanks for walking us through all that. And does anybody have any final questions before we wrap this first ever MPTA virtual conference? I don't see anybody jumping on the chat. Oh, thank you. All right, Laura, thank you too in the chat. Okay, perfect. Well, we'll let you guys go, give you an extra 10 minutes back in your day. Thank you guys again so much for being here. And thanks to everyone for participating in the 2020 virtual conference. And look for an evaluation survey coming in your inbox in the next, it says coming days, but
I want to see that.
It should be very soon. I'll make sure you make it on the list, okay?
Okay.
Okay.
Thanks, Jennifer.
If you guys think of anything after, you're like, oh, I wish
Yeah.
I had asked. Again, we're always not always, not at 3 in the morning, but we're pretty accessible. So just feel free to reach out.
Yeah, you'd be surprised at how many emails we answer at 10 o'clock at night or 11 o'clock. I mean, all the time, because I got nothing else to do, basically,
If there's any slides or any other presentation material or your contact information that you'd like for us to include when we upload this session to the website, we can certainly do that as well.
Okay.
So just send me an email and we'll go from there.
All right. Thank you.
All right. Thank you, everyone. We'll see you in
Thanks,
St.
Jen.
Louis next year. Okay.
Yes, yes.
All right. Bye,
All right,
guys.
Bye.
Thanks.
Bye.
Bye. you.